like to go ahead and call to order a special work session of the Sherwood School Board. I know we've likely got a pretty good sized audience online. I'm Pat Allen. I'm the chair of the school board. Um, Today we're here to have a conversation about what a path to reopening in-person education in Sherwood School District would look like. Just first, a couple of logistics. We're doing this as a hybrid meeting tonight. The school board and executive staff of the district are here in the room. There's 10 of us, physically spaced at 6 feet or more, and all of us wearing masks. And then the rest of the participants and anybody watching online is either in a Zoom room or watching our live stream. I want to take a couple of minutes and just sort of tee up, I think, what we're here to do. As most people know, the governor made a change in her policy about school opening and basically deferred control of reopening, or not reopening, but in-person education decisions beyond what was already available, and we'll talk some about that tonight, to local school boards. And so what we're what we're here to do tonight is talk about ultimately what does a path to that look like here in Sherwood. I say talk. This is a work session, and so I think we're much more likely to listen. We're not going to make any decisions tonight about any kind of a timeline or anything like that. We're going to start the meeting by listening to some fairly extensive public comment that's been submitted to us, and we want to read that into the record and all of us be able to hear it, and folks who are watching also be able to hear it. And then we've asked the district staff to basically present on a series of topics about what reopening does look like and what kinds of things need to be addressed, or what plans are in place, or what physical changes have been made in our schools, and those kinds of issues. The other thing, though, I want to be sure people understand is I'm super motivated to want to be able to get people and get kids in school, but I'm also super motivated to make sure we do it in a way that's safe for our kids and for their families and for our teachers and staff and for our communities. Department of Education is expected to come out with some revised guidance on a number of things on the 19th, and we're going to want to take a careful look at that. And included in that are likely to be some revised reopening metrics that the governor directed the department and the Oregon Health Authority to look at. There has been a lot of learning over the last year of the pandemic, nearly, in terms of science, data, experience in other places, and those metrics are being revised with an eye toward that. We have experience in other states. We have experience in other countries. We have recommendations from folks like the Harvard Global Health Program that are informing the design of those metrics. And so I think one of the things we're going to want to ultimately talk about is how we consider metrics as we move forward and think about those things in the issue, or in the set of deciding what a path going forward looks like. I think it's also important to think that as we try to get kids back in school, this is not sort of a school district project or a your kids teacher project or a district administration project. It's a whole community project. For this to work, one of the things we've really learned over the last year is ultimately schools are reflective of how much coronavirus is in a community, and the less there is, the better. And so all the things that we have done and continue to do to protect ourselves and our loved ones and our community become even more important. And I think we've all heard anecdotal stories about, sleepovers and gatherings and all the things that in my day job I tell people not to do. And I think those are all going to become really important for us to pay a lot of attention to make sure that we all collectively as a community keep the incidence of coronavirus in the community down. It's also really important to note that when and how we get kids back in person, school in person is not going to look like school in person look like, and we'll hear some about that tonight in the discussion. We've learned that doing things like wearing masks, physically distancing, lots of hand washing, not coming to work, or in this case school, when you're sick, actually really do work. They're disease prevention tools that have been around for a long time. And they've been around for a long time because they really are effective. And so using those tools in a school setting is also going to be really important to keep people safe. We'll hear a little bit, I think, tonight about the Ready Schools, Safe Learners guidance. We talked a bit about this when it first came out, but then we moved to the circumstance we're in now and haven't for a while. It's about 90 pages of really, really detailed guidance to school districts of how to do everything from transportation to ventilation and individual classroom design and those kinds of things. They have become a model for school systems around the country to pattern the protections that they build into their operations, and they are really built to a high standard. And then I think the last thing is we all have received lots and lots of email, calls, Facebook posts, whatnot. And there are very, very strong passions about this, and they run both directions. And they run both directions from parents, from members of the community, from our staff. And I think we absolutely are going to listen to that, but we're going to really be guided by science and by what's really the best path and plan for our kids. And so I just want to try to get that on the record. With that, let me stop and see if any board members have any other quick comments they want to make before we go into public comment. Seeing none, Ms. Andreg, I'll turn it to you for public comment.
Okay, thank you. So as of the start of our meeting, we have received 128 responses to our public comment. There you go. Is there any stipulations or any details you'd like to share before we start?
Sure. Let me just briefly say this will work pretty much like public comment at a regular board meeting does. At a regular board meeting, we ask people to identify themselves, give us their name and address for the record, and then we give them 3 minutes to make that comment. And so same thing here, Ms. Andreg will read comments to a maximum of 3 minutes. I think she'll probably try to read pretty fast to make sure we get as much comment in, but if we get to the end of 3 minutes, we'll stop and the document will be available for the record. We won't be reading anonymous comments or comments that we can't identify who the person is, same as we wouldn't let someone make comments who wouldn't identify themselves at the beginning of the meeting. I think that's all I need to cover, right?
Yep, that sounds right. Okay, and I just would like to thank Mr. Rose, who's going to be helping me tackle these comments tonight. So we'll be taking turns going through all these comments. So we're going to start with a comment from Elise at 17730 Southwest Elderview Drive. We are at the worst point of the pandemic. Several neighbors and their children have had or currently have COVID. While the governor has suggested schools make their own decisions, I hope this board in the school district take into account this is a very dangerous time to be reopening, not only for our children, but for the adults that they could spread COVID to. Oh yes, many parents are exhausted and would love to go back to a normal lifestyle. This is not the time to be doing this, and I hope the board does not cave to the pressure and still considers metrics. I have a second grader who is terrified to go back right now because he does not feel comfortable wearing masks all day at school, and he is scared he will catch something and bring it home. And I know several parents' children who feel this way. So while yes, distance learning is not the greatest for the children, being back in school, it's going to be more mentally damaging because teachers can't hug them when they're upset, they can't be close to their friends, etc. Also, what cleanliness is going to be occurring is that I'm going to be monitoring the bathrooms to make sure they're clean and children are actually washing their hands. Teachers are also going to spend most of the day reminding students to keep their masks on. Trust me, I know this. I've been in education and have sisters that teach in other states. Again, I don't believe this is the time to be heading back, and I really hope that this board does not cave to the families here that care more about going back to work in person than being a parent and protecting our families. And no, I don't want to switch my child to the complete cloud learning because then he loses his teacher that he's already built a relationship with. So please don't suggest that ridiculous notion. Thank you. Okay. Jenny Oaks at 17829 Southwest Ballard Lane, Sherwood. Please get our kids back in the classroom, especially our youngest learners. They need to connect in person with their class. This virus isn't going anywhere soon. The benefits versus risk are far greater returning kids to school. A hybrid model will even make an impact. I hope the staff will think hard out of the box on how to make school fun with the new safety measures and find ways to do recess and other activities young kids enjoy. My second grader has struggled staying motivated on Zoom, although his teacher has been fantastic and kept him on track. My very social kindergarten student needs more connection with school and would really benefit from even the smallest amount of FaceTime. If we continue on Zoom, it would be a tremendous help for the students to have the same schedule. Breaks and lunches being completely different for my kindergarten and second grader create a huge disruption, and if they had this time together, it would make a huge difference at our house. It is also my hope their hybrid schedule is the same for pickup and drop off. Thank you for all your hard work. Didi Grosso at 20712 Southwest Trailblazer Place. Comment, open up all grades K-12. Give our kids back some normalcy. They have all suffered enough from being locked up with no outlets to interact with peers in person, as well as much needed physical activities. As for mental health is concerned, we are facing the single greatest crisis among our youth. We need to rise above politics and put the needs of our youth first. Do the right thing and open up all schools 5 days a week.
Brenda Selby, 17103 Southwest King Richard Court. As you consider K-12 reopening, I urge you to consider the following. 1, avoid rushing students and staff back when COVID numbers are still high, and it will likely cause an unpredictable back and forth transition due to COVID exposures and quarantines. This will not help students, staff, or parents with consistency. 2, consider the workload of your teachers if they are expected to simultaneously teach groups in person and online. Teachers are already working tirelessly, and it is unsustainable to ask them to add more to their workload. 3, a safety plan needs to be in place that ensures the safety of all staff and students. Classrooms, school offices, buses, food services, cafeteria. With regards to airflow, sanitizing, social distancing, and daily health checks, contact tracing, and counseling support for staff and students in the case of a peer or staff member becomes severely ill or worse from COVID. 4, all staff should be given the opportunity to receive the vaccine before returning to in-person instruction. 5, be very clear with parents about what in-person school would look like. They need to understand the realities, as do their children, since some of the loudest voices are expecting normal. Those of us who work in education and know this will not be the reality. 5, there need to be no exceptions to mask wearing and social distancing for staff and students. It's not a political issue, it's a public health issue, period. Lastly, thank you for your work in thoughtfully and carefully determining the path forward from here. We've been pleased with how CDL has gone so far and cannot thank the teachers and staff enough for going above and beyond. I sincerely hope the SSD continues to be guided by science and data in this challenging time, considering all those affected by the decisions. Shelley Kapka, 23086 Southwest St. Charles Way. I would like the board to consider having 6th through 11th grades students attend summer classes. It is more difficult for this age group to get caught up once they fall behind in studies. Assessments and review of coursework during the summer months would provide kids with the knowledge they need to be successful during the fall school year. Students would also benefit from the routine established during summer attendance, avoiding the ramp up common after summer breaks. These students have essentially been out of school for a year. It wouldn't be right to throw them back into the classroom and expect them to be competent and attentive. Please consider this and hold another special work session with summer school as an agenda topic. Thank you.
From Aaron Hines at 18294 Southwest Orchard Hill Lane, Sherwood, Oregon. The children in our district are failing to thrive with the current distance learning environment. Although I believe the way in which SSD has approached distance learning supersedes what other surrounding districts are doing, as a mother, I believe our kids deserve better. All of the students in our district K-12 are losing out on so many opportunities for personal and academic development and social interaction. We as a community and you as decision makers owe it to the children of our community to reopen schools. Consider the inequities of the children in our district, children with IEPs and children with physical and emotional needs that are best served in the school environment. See the faces of the children at high risk for abuse and neglect, the children who are hungry, the children in need of healthy adult relationships. Look at the more open parts of our country who have somehow managed to have kids of all ages in schools the majority of this pandemic with no major disease outbreaks. Please weigh the facts. Kids are permitted to go grocery shopping, daycares are open, they can play at the park, and OSAA is even working to begin sporting activities. If these things can happen, there is no rational reason why the children of our district cannot go to school in person. Please consider who have been deemed essential workers throughout this time. There have been folks who have been working throughout the entire shutdown of our country. Single parents working 2 jobs to provide for their children, Walmart, Costco, and grocery store workers, and medical professionals. Children are important and essential, and so are their teachers. Please stand firm and do not allow the teacher unions to dictate what happens in our community. There are opportunities for teachers to get vaccinated if they so desire, and there are online teaching opportunities if they are uncomfortable doing their job in the classroom with their students. Please move forward with the required precautions to get our kids, elementary through high school, into the classroom in the coming weeks. Please communicate with parents each step of the way so we can tell our kids who desperately need and want to see the insides of their schools and classrooms this year that there is hope. Please don't waste taxpayers' time and money on bureaucratic meetings and brainstorming sessions that never go anywhere. Employees have been in buildings since March, and safety protocols have been communicated from the executive branch since early on, and funding has been promised in order to do so. Our schools should be ready for our kids. Our community and its future depends on you to make the right decision and support our most precious and vulnerable population. Erin Hines, mother of Cash, 4th grade, and Eleanor, 3rd grade, Ridges Elementary School. Catherine Smith, 23310 Southwest Redfern Place. Please allow our students at the high school level back to in-person learning first. Small children will not remember this time. Teenagers will remember depression and isolation. A student in the Wilsonville West Lynn School District died by suicide on Saturday, 12/26. He was a junior. My sister lives in that district and read to me the sad email. Please focus on the seniors and high school students first because mental health is important. Thank you.
Paula Brown, 19445 Southwest Edie Road, Sherwood, Oregon. I am very pleased that you are considering how to safely open schools. My high school senior and sophomore would be so much better off if they could come to the building in a hybrid model. As my college-age son says, there are classes that are really hard to take in an online format: science labs, culinary arts, and STEM. Fortunately for him, he can put those classes off until his college reopens. But high schoolers cannot do that since schedule changes are very limited. I hope you will consider opening all buildings in the district with safeguards rather than just opening elementary and leaving the secondary buildings empty. Thank you for your thoughtful consideration. Alicia Kelly, 21481 Southwest Rolich Avenue, Sherwood. The children in our district are failing to thrive with the current distance learning environment. Although I believe the way in which SSD has approached distance learning supersedes what other surrounding districts are doing, as a mother, I believe our kids deserve better. All of the students in our district, K-12, are losing out on so many opportunities for personal and academic development and social interaction. We as a community and you as decision makers owe it to the children of our community to reopen schools. Consider the inequities of the children in our district, children with IEPs and children with physical and emotional needs that are best served in the school environment. See the faces of the children at high risk for abuse and neglect, the children who are hungry, the children in need of healthy adult relationships. Look at more open parts of our country who have somehow managed to have kids of all ages in schools the majority of this pandemic with no major disease outbreaks. Please weigh the facts. Kids are permitted to go to grocery, shopping, daycares are open, they can play at the park, and OSAA is even working to begin sporting activities. If these things can happen, there is no rational reason why the children of our district cannot go to school in person. Please consider who have been deemed essential workers throughout this time. There have been folks who have been working throughout the entire shutdown of our country, single parents working 2 jobs to provide for their children, Walmart, Costco, and grocery store workers, and medical professionals. Children are important and essential, and so are the teachers. Please stand firm and do not allow the teachers union to dictate what happens in our community. These are opportunities for teachers to get vaccinated. There are opportunities for teachers to get vaccinated if they so desire, and there are online teaching opportunities if they are uncomfortable doing their job in the classroom with their students. Please move forward with the required precautions to get our kids, elementary through high school, into the classroom in the coming weeks. Please communicate with parents each step of the way so we can tell our kids who desperately need and want to see the insides of the schools and classrooms this year that there is hope. Please don't waste taxpayer money and time on bureaucratic meetings and brainstorming sessions that never go anywhere. Employees have been in the building since March, and safety protocols have been communicated from the executive branch since early on, and funding has been promised in order to do so. Our schools should be ready for our kids. Our community and its future depends on you to make the right decision to support our most precious and vulnerable population. Alicia Kelly, mother of Callan, 3rd grade, Ridges Elementary.
Kristen McConnell, 21285 Southwest Elwart Road, Sherwood. Dear Sherwood School District Board of Directors, our family appreciates the immense care, concern, and caution you have shown for the safety of our students, teachers, and families. Not to mention the work you have done since last March. There is no one-size-fits-all solution, but please take the playbook from other states and districts who have found a safe way to get students and teachers back in the classroom. You had plans started, move forward with them. Many of us want this: teachers, students, families, the community, and more. We realize some may still prefer the CDL model, and that is certainly fine, but it is no longer acceptable that for those who want and need nothing more than to be back in school are still at home. Our students have a right to be educated and a desire to be with their peers and in their school community. You've heard every argument out there on mental health, safety concerns, etc. Please take their best interest and well-being to heart. Don't focus on reasons not to open up our classrooms. Instead, put the efforts towards getting teachers and students back to school safely. It can work. Other states and districts have proved this. This is the world we live in, and we can't just stay home forever and be satisfied. This is no longer acceptable. Finally, please do not underestimate the need for students of all ages to be back in school. Our students grades 4 through 12 have just as much need to be back as our students K through 3. Let's make this happen. We are confident a solution is there. Thank you, Kristen and Brian McConnell. Angie Sutton, 23329 Southwest Shirk Place. All Sherwood students should return to school. Our young students need to be in class to learn how to be in school and around others again. Our middle and high school students need to be in class for their mental and emotional state more than anything. Please consider a safe return for all of our students. Jesse Bittner, 14600 Southwest Bell Road, Sherwood. I cannot emphasize enough the need we have to get our children back to in-person education at all levels. I have 3 children. My eldest just graduated high school with honors last spring and began his college education this fall. The extended break between was very noticeable in his ability to jump back into education. There is no way this is not going to negatively impact my 2 younger daughters' education. Specifically my middle daughter, who is a junior, that currently only has 3 official classes. Her classes include an art class, a Microsoft computer class, anatomy, and early release. This is in no way preparing her for college, which she is eagerly anticipating. Lastly, my youngest daughter, a freshman, has anticipated participating in all the high school activities, including combined classes with various grades, athletics, and other activities. These are unquantifiable experiences and opportunities for learning, growth, and maturity that you cannot replicate in a virtual setting. We can do better. Our community deserves better. Our future success demands better. We should not and cannot expect our children to carry the burden of this pandemic, especially if we are not willing to adequately prepare them for what the future has in store for them. They need to be back to in-person education for many reasons, but just to name a few, they need accountability. They require socialization for healthy mental preparedness. They need personal contact, connection. Please do the right thing. We are not called to live by fear. We can live responsibly and require that of our high school students. It is possible for them to attend school together and be socially responsible to wash their hands, respect boundaries, and stay home if they aren't feeling well, but we aren't even giving them the chance to make responsible choices. Please, this really is of the utmost importance. Please remove any and all barriers to get them back. Our future depends on this moment.
Laura Fuller, 16861 Southwest Holly Farms Lane. Dear Sherwood School Board, according to the 12/30/20 last available of this writing, zip code map provided by Oregon Live, less than 2% of the Sherwood population has been infected with COVID-19. 10 months after our mandated social isolation, the data is clear. It is those over 65 and those in poor health who actually die from COVID, and children do not contract and spread the disease as easily. Please put the needs of our children over the wants of the teachers union. All other workers, grocery store clerks, retail cashiers, food servers, delivery, repair people, healthcare workers, etc., are able and willing to work with the public of all ages and health status. The teachers will work with a limited number of kids in a controlled setting. Kids need real-life interaction. They need physical movement. They need to be off of the screens. It is time to do what you need to do to make this happen. Recruit more aides or volunteers, place desks in gyms or other large areas for those that need it. Even the most resilient kids are starting to show the cracks, resulting from the isolation and too much screen time. Our high school age children are capable of distancing, wearing masks, and practicing good hygiene. Please let them return to school. Of course, there are those parents that wish to keep their kids online, and that's an option still available to them. But for the rest of our children, please, please, please make them the priority now. Thank you. Chelsea Gallagher, 22995 Southwest Main Street. My son is a first grader in the hybrid program. When we enrolled in that, my understanding was that he would go only back if the metrics were met. Now all that has changed. Despite us not having a vaccine widely available, cases at an all-time high, and hospitalizations high, we are now allowed to go back. We no longer would be comfortable sending him back for a few months when his adult parents are not vaccinated. It's not a risk worth taking, and not responsible as a nurse who has seen firsthand the devastation that this has caused on our hospital staff. Once the vaccine is available to protect the parents of children in school, that is when schools should go back. If we are forced to go back to hybrid now, my son would have to switch teachers and go to the cloud campus. That would be devastating. He is thriving with his teacher and established at home. Please pave a path for kids doing well to stay home and keep their current teachers, or better yet, plan on going back in the fall when we can do this safely.
Jill and Justin Kai, 22118 Southwest Friars Lane, Sherwood. Dear Sherwood School District Board members, our names are Jill and Justin Kai, and we are the parents of a kindergartner at the Ridges and 2 other younger children who will be in the school district in a couple years. We are urging you to strongly consider opening our schools for in-person learning, at least for our youngest learners who don't have the maturity or focus to learn through a screen. Last year, we held our kindergartner back a year because he struggled so much with distance learning at the end of the year. We can't do it again. All the students in Sherwood have different situations and stories, and the solution doesn't have to be all or nothing. We already entered the year with a comprehensive distance learning plan that provided both cloud and hybrid options if the metrics allowed for it. The metrics are no longer a hurdle, so schools should start to follow these plans. Now that teachers and staff are next in line for the vaccine, those who are willing can more safely go back to teaching our children in person, and the cloud option should be made available for students' families who aren't comfortable going back yet. As Kate Brown said in her letter, it's been shown that spread mostly occurs at large gatherings where precautions haven't been placed, and that it is actually safer in controlled environments. Children are not super spreaders like they are with colds and the flu. Daycares and preschools in the area have been open this whole time, following protocols, and we haven't heard any reports of major outbreaks. Schools across the nation have been able to open with only handfuls of cases, which were addressed by class quarantines. Please know that this isn't just a childcare issue, although many working families are truly suffering. Teaching our kids is totally different from just caring for them. We value our teachers so much. They perform an extremely important job that not just anyone can do. Research has shown that early learning is critical for the long-term success of our children. Please work to find creative solutions that allow for in-person learning for the students and families that need it. And don't just look at this as a yes or no decision. Thank you for your ongoing care and concern for the children of Sherwood. We appreciate all the work that has gone into making distance learning as successful as it can be. It is clear that the well-being and success of students is a top priority for you and our incredible teachers. Thank you for your consideration, Jill and Justin Kai. Morgan Lucio, 23410 Southwest Redfern Place. While I would love to see my child return to school, I am deeply concerned for the negative repercussions as it pertains to health and safety of students and staff. Brian Brown, 19445 Southwest Edie Road. Thank you for jumping on this opportunity. My two high schoolers are looking forward to being in that shiny new building next quarter. Abigail Hawkins, 23574 Southwest McLaughlin Court. I feel it is essential our children get back into a classroom setting as soon as possible. I see no reason why other states are able to safely manage this with much higher numbers than Oregon. I firmly support kids quickly returning to school.
John Bowden, 21495 Southwest Edie Road, Sherwood, Oregon. The challenges to returning to in-person learning are significant, especially in a district that hasn't had it in almost a year. However, I believe this is the only responsible alternative if we truly value our children's and students' mental health, educational, and social development. While the challenges are daunting, the overwhelming majority of Western Europe has kept in-person learning for K-12 during the school year. As you also know, the vast majority of US states continue with K-12 in-person learning too. Preschools and childcare centers also have in-person learning, both in our own city and across the US. From a practical standpoint for families balancing work and life responsibilities, I would ask that the district staff to keep siblings in the same cohorts, at a minimum within the same school, as I realize this would be a challenge across multiple schools. Sherwood has tremendous families and strong support for the district. However, a significant number of families have already switched to traditional homeschooling options, and many more have temporarily or permanently relocated out of state for in-person schooling options. A very significant portion of district families have the means and ability to do either of these options to help our kids. Remote work means many families can live anywhere they want for the foreseeable future while working for the same local employers. A number of local families have already done this, and I know many more that are thinking of relocating due to schooling. I believe this will begin to have a meaningful impact on the district's finances, as a large percentage of Sherwood's residents have been working remotely for almost 10 months now, quite successfully. At the same time, many of these employers, including Nike and Intel, are going to support remote work indefinitely. Thanks for your consideration, John Bowden. Mindy Mickelson, 22911 Southwest Hostler Way, Sherwood. Our students need to be in person for school. The quality of online teaching has been way below acceptable standards. Our students need human interaction and quality in-person learning. They're falling behind, and they are the customer, the reason school exists. Many schools in the US, states, and even institutions in our own state safely and successfully conducted in-person learning throughout the entire fall semester and plan to return in person in January for spring semester. There are safe ways to make it happen. With the addition of the new high school and move to the middle schools to the old high school, Sherwood has ample amount of room to create socially distanced classrooms. There should be no reason to keep students away from the schools any longer. The science and statistics published over the past several months have proven our K-12 students are not at risk of death. It's hurting them more by keeping them out of the classroom. Do the right thing and provide the proper in-person instruction that the community taxpayers are paying for.
Kristen Douglas, MD, 23878 Southwest Robson Terrace, Sherwood. There is mounting evidence that we are doing more harm to our children having them enrolled in comprehensive distance learning. As a mother of 5 children, pediatrician, and youth leader volunteer, I am equipped to express my views. In support of my views that kids should be in person are the AAP, CDC, and Dr. Fauci. Typically, we look to the medical experts to help us make informed health decisions. I think that not only our kids' academic health is being affected, but our kids' mental health, physical health, and emotional health. We are made to be in community with others. The marginalized are being even more pushed down with online school. The inequities will widen if we continue to have distance learning. My own kids are not engaged and dread being online for 6 hours a day. Teachers struggle to connect with blank screens and kids not sharing in breakout groups. Does anybody think that this is best for our children, which are our future? Please look at the science that supports opening schools for in-person education. We need to do what's right for the future of our kids. With vaccines available for our teachers, please get these essential workers back to in-person teaching. Katrina Cole, 17713 Southwest Dodson Drive, Sherwood. As a parent and an educator, I fully support returning to in-person instruction for all grade levels. It's time to get our kids back in school. Education is essential, and online school is simply not as effective for the majority of students. Jeff at 19757 Southwest Shoals Sherwood Road. What type of chemical cleaning compounds are being used in the schools to address the virus? I believe these should be made publicly known, as there have been studies showing negative long-term exposure from certain types. For example, chemicals containing quaternary ammonium compounds. Thanks. Lindsay Redmond, 21658 Southwest Berkshire Terrace, Sherwood. I am in strong support of returning to face-to-face learning. Please send our students back to school. They are desperate to be in social situations again. We are doing so much harm isolating our kids.
George Burkamp, 16300 Southwest Brookman Road, Sherwood. Our board directors, superintendent, and community have been provided with an excellent opportunity to utilize recent research, examples of back-to-school successes in other parts of the U.S., common sense, and no political agendas to send our students, all students, back to school. Recent emergent research has shown that K-12 children contract and spread COVID-19 at rates as much as 50% lower than adults. This, combined with mask mandates and cleaning protocols, has the potential to make Sherwood schools some of the safest environments for our kids as the pandemic continues. I challenge the board, administrators, teachers, and parents to make good on their commitments to their jobs and to our kids by investing the time and energy required to develop and execute a comprehensive plan that well balances our students' health, academic progress, and mental well-being. This plan should likely be different than neighboring districts. It will likely require parent and community participation, and it should likely be a plan that is unique to Sherwood because, quite frankly, we owe it to our kids to be better than the rest of Oregon. As a parent of a high school senior, I find it unfathomable that our senior class has potential to not utilize, experience, and enjoy a facility, even for a short period of time, that the community has invested so heavily in. Although I am in favor of all students returning at a minimum, I would support just the senior class returning at the high school level to in-person instruction. In this scenario, space most certainly would not be an issue. Let's provide the leadership that our students deserve. Amy Gillette, 17589 Southwest Wapato Street, Sherwood. Thank you for continuing to keep the school staff and students safe. Vaccines are just around the corner and will provide an additional layer of safety to those working and learning in the school buildings. I know we all want what is best for our community, and that playing a long game is needed at this time. Thank you for saving lives. Bill and Anseloni Evanuk, 17980 Southwest Eldred Lane. Sending students and staff to schools before vaccinations is not only dangerous, it would be irresponsible. The health and safety of our community during a pandemic should be the utmost priority. Kira Steger, 21257 Southwest Yorkshire Way, Sherwood. Please get our children back into school full-time, please get our children back into full-time regular school. This has been a life-altering experience that needs to stop. Our children's, families, and future society are at stake.
Lindsay Rainine, 23456 Southwest St. Charles Way, Sherwood. I can imagine how difficult it has been to make decisions on behalf of the safety of this community over the last year. So many people have worked very hard to transition to in-home learning, and I have been, as a parent, very comfortable with and proud of the decisions the district has made with the limitations given from the state. My concern now is there's a very loud group of parents who are putting significant pressure on this community to return to school buildings. I have seen a change.org petition and the comments in social media. There has not yet been an equally loud or active group expressing the opinion of continued, well-designed, and patient caution. Sometimes it seems like the voices behind returning to school are coming from a desire to get back to normal. I guess I can empathize, but surely we can agree normal isn't a thing as long as our teachers, staff, students, and parents remain unvaccinated. The virus continues to spread, and there is a poorly understood mutation that has recently been discovered. I simply want this board to know, and the community at large, that there is a patient, well-informed, and relatively quiet group of parents and students in Sherwood who have adjusted to school from home, finally and with no small effort, and we support continuing this model until our teachers and staff are vaccinated. Vaccinations first. Respectfully, parent of 2 in Sherwood schools, Lindsay Bernine. Annette Vargason, 17823 Southwest Frederick Lane, Sherwood. I'm thrilled that Governor Brown is allowing communities like Sherwood to determine the best path to returning our students to in-person learning. It has become clear that our students, teachers, and staff need this option, and there are many examples where the combination of masks and basic procedures make in-person schooling very safe. Please work to support Sherwood students by making an in-person learning option available ASAP.
Megan Phillips, 16014 Southwest Hawk Court, Sherwood. Our children need to be back in school with their peers. The mental health of kids is severely declining and rapidly so. Depression is setting in for so many kids. Get these kids back to classrooms and back being kids. They need some normalcy. They need their friends. Open our schools. Angela Christ, 23217 Southwest Orchard Heights Place. Schools reopening needs to be top priority. Teachers need to be considered essential workers, and those that want the vaccine should have access to it. Our kids deserve better than this. Valerie Giltz, 23333 Southwest St. Charles Way, Sherwood. Thank you for taking the time to meet. I feel I would be doing a disservice to my third grader if I didn't write asking to consider in-person instruction for those who need or want it. He cries every single day. He hates virtual school. It's too hard to focus all day while being at home. His teacher is amazing and doing an excellent job, but it's just not working. He cries, "Mom, please, can I just go to school?" It breaks my heart seeing him and my 6-year-old sitting silent all day waiting to be unmuted for 2 seconds to answer. My 6-year-old wrote a persuasive letter to Kate Brown asking her to let schools open. He feels frustrated because he feels like he never has the right assignments. His words. Once again, his teacher is every bit of amazing, but the isolation is too much. I don't think forcing everyone to school is the right answer, but we have to be able to do better than we currently are. Thanks again for your time. Serena Gregory, Kruger Road. Superintendent Cordy and School Board, please let me go to school again. Distance learning is very difficult and lonely. I do not get to see my friends hardly ever anymore. I'm starting middle school, and to me, having time with friends is the most important thing. I miss seeing kids my age on a regular basis. I also miss being able to communicate with my teachers and ask questions in normal ways. It is very difficult to focus at home with so many distractions. It is not a school atmosphere at home. We also have experienced a lot of computer glitches and shutdowns that have made it more challenging to learn. I love to read and have not been able to get books from the library that I would be able to get if I were attending school. It is also hard to understand assignments without the teachers being able to be more hands-on like they normally would be able to. In conclusion, can you please open our schools for me and my siblings to go to? Sincerely, Serena. Jamie Monahan, 17186 Southwest Carlson Street. Let's get these kids back to school.
Kelsey Belstein, 17650 Northeast Leander Drive, Sherwood. Hello, I'm writing you out of pure frustration and helplessness. I pride myself on being able to problem solve and figure things out, but I'm at a loss. My kids are not learning, my job is suffering, my husband's job is suffering, and the kids and I are always in tears by the end of the day. I know our government says we just need to bear through this, but something has to give. If we don't have an adult sitting with them the whole day then the kids are lost, just squirm and fidget with anything around them. If I take the day off work and try to help them, they have no idea how to do anything, and I feel like I just end up giving them all the answers so that we can get something done to turn in. I know that the teachers will allow us to take more time and turn in assignments late, but they are done after school, and I have to make up the work I have lost while I've been in school with them, not learning anything. So it ends up being a lose-lose situation. We also need downtime. All of our mental health is suffering. My first grader is not on track to reach her first grade benchmark in any subject. The only time I feel like she is actually learning is in her tier 3 reading group, but by no means is it helping her catch up to the other kids' reading level. The IEP team has decided to evaluate her, but even they say they do not know when that will be able to happen because of everything around COVID. I myself have a learning disability and I know how delayed help can affect her, and it breaks my heart. I feel as though I have picked up a part-time job to be an advocate for her on top of my full-time job, but she is only falling further and further behind with distance learning. My third grader's teacher teaches a lesson and then puts them in small groups to work together, but then none of the kids know what they are supposed to be doing, or if any of the kids have a tech problem, they spend the whole time trying to fix it. I try to step in and help, but it's usually with math, but they teach it completely different than when I learned, so helping only confuses them more. One kid ends up doing all the work and nothing is turned in from the group time, so there is no way for the teacher to know if the kids understood the concept at all. There is no way for the teacher to know if my child is struggling or if he needs coaching until the end of the unit test. I have asked if the school has any tutors or programs they can recommend to support my kids, and they have not provided me with any resources. At this point, it feels like we have decided it's okay for our kids to fail and just kick the can down the road. There is a much higher risk with my kids being at home than them possibly being exposed to COVID. We are supposed to live in a free country where we can make choices for ourselves after we weigh the risks. Let us parents and teachers that want to go back to in-person learning go back. And let those that want to continue distance learning continue. Everyone needs to have the freedom to make their own choices. Daniel McKenzie, 22852 Southwest Forest Creek Drive, Unit 200, Sherwood. Our kids need to be back in the classrooms immediately. Enough is enough. Liz McKenzie, 22852 Southwest Forest Creek Drive, Unit 200, Sherwood. It's been nearly a year, and we now have more than enough evidence to support a complete return to in-person schooling. Open up our schools now.
Briar Low, 16918 Southwest Cobblestone Drive. I'm surely hoping that you know that opening the schools has to happen. It's not a matter of whether to do it or not, it should be a matter of how and when. The conversation needs to shift from the risks of opening versus the risks of keeping schools closed. It's evident the negative impacts are mental health, hunger, obesity with inactivity, child abuse, missing routine medical care, on top of the loss of education. When looking at data, being from the world or stateside, it's clear that the research finds few links between schools and COVID-19. Compare the information on Utah's COVID-19 surveillance. They've been in school like usual, and their state has less deaths than ours. Look at studies done in Spain, again proving that in-school learning can be successful in the midst of the pandemic. In order to make the schools safe, protocols must be followed, with regular testing, contact tracing to identify the source of outbreaks, and reporting of cases publicly, regularly and consistently. Schools must promote behaviors that reduce the spread, maintain healthy environments and operations, and prepare for when someone gets sick. It can be done. It must be done. I would assume that a phase and approach is already in place and ready to move forward rather quickly. You've had ample time to get organized and set this up in the previous months. The Ready School Safe Learners guidance is your blueprint to forge ahead with warp speed. This is what we expect as taxpayers, constituents in our district, and supporters of future contributors in society, the kids. Regarding teachers and their unions, the children must come first. If you have a teacher who has COVID phobia, then that teacher should have the option to teach distantly. And if that's not possible, maybe a severance should be given as an option. Just like every other corporation on the planet, the children must come first. Doctors take an oath of ethics. Police take an oath of honor. For teachers, the commitment needs to be fulfilled, your oath to educate. Please see COVID-19 school response dashboard. Eleanor Haynes, third grade, 18294 Southwest Orchard Hill Lane. Dear teachers, I hope this note is inspiring because I really want to go back to school during 2021. It's been a very hard year. I think we should definitely go back to school this year. I want to see my teacher in person. I want to see my new classroom in person. I want to see my new classmates in person. And I want to do all of this year. Coronavirus has been going on for almost a year. The whole time we are in virtual school, we have been in a device and being on a device and being on a screen all day is not good for students or teachers. We are on school devices for hours, and in real school, that would not happen. And we are a lot more active in real school, and it is sad we can't be in restaurants, but we still have the chance with school. So please bring us back. Sincerely, Eleanor Haynes, 3rd grade at the Ridges.
Ryan Bernard, 18292 Southwest Timber Lane, Sherwood. We claim to be doing what is best in saving lives by keeping all our kids home from school, yet that is not true. We are doing what is best for everyone else, not our kids. Children all over the country have been back to school, and our kids are left on the sideline to flounder and just get by as best they can. It's time for us to put Oregon's younger generation on the top of the priority list, not at the bottom where they currently are. Let's be honest, if we're talking real numbers that matter, distance learning is an educational failure like we've never seen before. If this was a normal year with these same results, people would be losing their jobs and grand changes would be on their way. The individual schools and teachers are doing the best they can with their hands tied by the state, but that has gone on way too long. We are failing our kids, and the only reason we can provide them is just because. Please send our kids back to school where they belong. Let them actually learn, let teachers actually teach, and let the kids learn from other human beings by experiencing real life again in real time in person. Thank you for doing what is right and best for our kids. Send them back to school. Eric Anderson, 17175 Southwest Meineke Road, Sherwood. Since the beginning of the COVID crisis, you have claimed to follow the science. All of the science has said that kids should be in school and has for a very long time. This applies to all the science related to COVID spread, as well as the science related to the mental and emotional health and well-being of our youth. To claim otherwise is a lie. There is no excuse for our schools to still be closed, and I urge you to follow your own advice to follow the science and get these kids back in class. A vote against this demonstrates your commitment to political agendas and lies not to the science you claim to follow or the well-being of our children. We recognize some may not want to return. That is their decision to make, but you must provide an in-person option for all grades in addition to the online-only model. Thank you for your time. Dana Everett, 17090 Southwest Stellar Drive, Sherwood. How will the demands of the teachers union impact the timeline for our kids to return to in-person learning at school? Can we utilize best practices from schools who have successfully transitioned to full-time in-person learning to get our kids back to school as soon as possible? Kelly Nelson, 7348 Southwest Beauchain Court, Wilsonville, Oregon. I'm a 2nd grade teacher at Archer Glen who lives out of district in Wilsonville with 2 elementary age children of my own, 1st grade and 2nd grade. I would like to encourage the board to consider trying to align return to school plans and schedules with surrounding districts. If this is not possible, I would encourage the board to consider some flexibility and accommodation with respect to temporary out-of-district transfers. During this unprecedented time, allowing staff members to bring their out-of-district children to their own workplace school would greatly simplify schedules and reduce the overall exposure level for the household. Jamie Dutra, 23115 Southwest Price Terrace, Sherwood. As much as I want kids back in the classroom, I want to be sure teachers, staff, and administrators have safety precautions in place. How is the district going to ensure safety of the unvaccinated staff and have kids return to the classroom? Nick Everett, 17090 Southwest Stellar Drive, Sherwood. We've all seen the research from the CDC that recommends kids should be back in school. We've also seen the uptick in mental health struggles across our youth as a direct result of the distance learning model. What is our school district going to do to get our kids back in school as soon as possible? Other states have successfully transitioned back to in-person learning for months. What is holding our school district back from opening as soon as possible? Why can't we adapt their best practices?
Katie Simpson, 23828 Southwest Dewberry Place. Hello, Sherwood School Board. I'm an elementary teacher in Sherwood. I'm honored to teach in this district and this incredible community. I'm writing this comment in the effort to share the perspective of a dedicated teacher and wife, mother, and mother. I love my students. I'm very proud of the community we have created in our distance learning classroom, and I care about each individual very much. I'm also a mother of a first grader in the district. My husband is in the high risk category for COVID-19. This puts me in a position of needing to protect my family as well as the well being of my students and their families. I choose to teach my class in the CDL model based on the metrics shared in the fall. I understood that we would likely go back to school with much lower COVID cases in our community. Many teachers are feeling pulled in two directions, protecting the health of our families and doing the very best for our students. I know this is extremely complicated. I know this is an extremely complicated situation involving many factors to consider. There is a feeling of urgency and pressure in the air. Many staff members and families feel that waiting for staff to have the option to be vaccinated and or for the high COVID case numbers to go down is the safest option. We are so close. When planning for in-person instruction, please consider the safety of students eating in classrooms. With current conditions, we are not allowed to eat inside restaurants. Spending an extended amount of time without masks in a classroom creates a vulnerable situation for all parties involved. I hope this will be considered in decision making. Please know I want what is best for our students and their families. I want my class to thrive and to be in the safest learning environment possible. Thank you for your consideration. Sherry Schultz, 15944 Southwest Oriole Court. I'm an RN and I know what this virus is doing to people. Our family lost a loved one right before Christmas due to COVID. We know at least 8 others personally who have COVID right now, and they are suffering. I also know a few people who had it back in April and recovered. Really, the initial symptoms they recovered from, but they are still suffering ill effects from having had the virus. This virus is no joke. It is real. And sure, okay, maybe kids don't get it as often, but they can still carry it home to others. When you feel terrible if a bunch of kids, parents, and grandparents from our community to get sick or die, COVID is very contagious, hence the reason for masks and social distancing. Our family has been very strict following restrictions the entire time since March. I take care of my 80-year-old in-laws who cannot get the virus. My kids, as most others I am sure, have missed out so much socially, and they do it all for the good of the community. Please don't let all the efforts of most people, including all of our kids who do follow restrictions, just go to waste. Not to mention opening would also put all of our hardworking teachers and staff at risk, which could have long-lasting effects and could cause us to lose a lot of great teachers and staff either due to illness, death, or not being able to return due to long-lasting effects from having the virus. Please be very careful in how you open our schools. Please make sure you can test often. Please make sure you have all the safety measures in place. Please clean the classrooms and schools every day, not just once or twice a week. Please think long-term about this, not just short-term. Our kids are getting pretty decent instruction right now, considering how new this all is. And I know it is not ideal, and there are kids that do really need the services from school, and my understanding is they are getting those services. Look and listen to other districts. We are not doing too bad overall, better than most districts. Do we want this virus to last longer, or do we want to work together to keep our community as healthy and safe as we can until the general public can get the full series of the vaccine? I would hope we would all want to work together, not just focus on the here and now, because if we only focus on the here and now, this virus will never go away and more people will suffer. Most of all of our kids in the community, which is the worst of it all. Please, just be careful opening our schools, and don't make it mandatory to attend in person. Let families make the decisions that are best for them. Please keep the all online option available to those who are unable to go in person school. Thank you.
Terry Gent, 17229 Southwest Galewood Drive. Our son was one of your top seniors this year. He is up for the National Merit Scholarship. He should have been one of your valedictorians. His goal was MIT. The list of schools trying to get him to apply was incredible. The end of last year was a horrid experience for him. I defended the school. You were thrown for a loop. I tried everything I could do to prepare him for this coming year. He felt abandoned by the school, though. At some point, he just gave up. Unfortunately, he couldn't see that there is hope at the end of the tunnel. Besides that, he felt like his school no longer cared about him. I've read comments in this community blaming our kids if they haven't been resilient. I'm not really sure where the blame lies. What I know is I now have a kid that I'm hoping just graduates. I no longer worry about college next year. I'm focused on getting him mentally healthy. As a mom, I feel robbed. I know he feels robbed. He feels as if the past 17 years of hard work are a waste. I know we will push through and be better for this in the end, but I can't say I'm not incredibly disappointed. I think that the school board needs to hear these stories. You need to know what is going on in our community. Lisa Neal, 20991 Southwest Wagon Train Place. Please bring our children back to school. I understand not everyone is ready to send their children back to school, but many of us are ready. My first grader is having serious mental health issues as a result of the school shutdown. It is very difficult for a first grader to develop academically and socially through distance learning. The teachers are doing an outstanding job with the live Zoom teaching, but these kids need more. I have a friend in Ohio whose children started back to school 5 days a week with masks in August. They went to school for 10 weeks straight before high numbers in their county, not their school, made them switch to hybrid schooling. They have proven results that kids are not the spreaders of COVID, and if masks are worn, they do not spread the disease. Please get our children back to school soon. While they are resilient, this is taking too much of a toll on their physical and mental health. Thank you for all the hard work you are doing to support our children. Kristen Holter, Hawksview Elementary. I am a learning specialist in the Sherwood School District. I am concerned with the abandoning of safety metrics meant to keep my family and those I love and care about safe. With my team teacher, we supervise 10 IAs in the special education department and have had participation and engagement at all grade levels. Some students have struggled, but I have students that struggle no matter what the educational experience looks like. I have also had students who have flourished in CDL. I have done all that I can to remain safe. I wear my mask, I stay home. Thanksgiving, Christmas, and New Year's for my family were all canceled this year. I have a son who is immunosuppressed, parents in their 80s, and a significant other who has been a type 1 diabetic for 47 years. It makes no sense to me that I cannot be around my family or eat in a restaurant, but we are looking at going back to school. I will not be returning to teach until I have had both of the shots that protect me and therefore my family against COVID-19. I love my job. I love my students. I'm excited to see my students again in person and figure out where to go from here, what they missed, where they have regressed, and what they need to get back on track towards progress. It is not, in my opinion, something that needs to be rushed or foolishly attempted in a way that may harm our district staff, my peers and friends, and or my students and their families, and my family and myself. I urge you to consider waiting until we can all be safe, until we have all been vaccinated.
Deborah Quattrochi, 17085 Southwest King Richard Court, Sherwood. Will we have been given the 2 vaccines before in-person classes start? If not, are we still expected to participate? I am a school bus driver and cannot bring COVID-19 home to high-risk persons. What are my options? Jody Ditson, 24545 Southwest Grand Vista Drive, Sherwood. We are a country of doers and dreamers, and we instill this in our children, our future. Although this is a difficult time for everyone, it is definitely a time to partner together to find solutions to move forward in educating our kids using in-person learning in the schools. This is critical for social development and mental health. It is very scary to think of the deficits and damage that isolation of children long-term may create. As a healthcare provider who has been treating patients safely through COVID, I know we can find a safe and manageable way to successfully bring kids back to the classroom. Cash Hines, 18294 Southwest Orchard Hill Lane. I miss school because I miss seeing my friends and everyone at school, and even though there's a pandemic, we should still go to school because we are on a screen all day and that's not good for us. And sometimes we do fun activities and fun things when we're in school, and I'm pretty sure everyone else wants to go back to school too. It's fun to hang out with your friends. Cash Hines, 4th grade Ridges. JD Hines, 18294 Southwest Orchard Hill Lane. To the school board, as another parent to write the district, we are asking asking to get our two kids, Cash and Eleanor, back to school right away. There have been many measures put in place to help keep kids safe in their daily lives, and they can no longer be at home all day staring at a screen, wondering when they will go back to in-person school. Also, with the vaccine in place and many other states without closures, distancing, and seeing results that have worked, it is time to follow like our governor has with everything else. We appreciate the teachers and believe that they can teach under strict guidance to stay safe and allow our kids to go back to school in person with minimum risk. Let's move forward and not backward. Lake Oswego just said yes, time for Sherwood to follow. JD. Karen Tasker, 25050 Southwest Baker Road, Sherwood. If the school opens before staff is vaccinated, what plans does the school have to protect staff who are considered high risk? What options do we have if we feel uncomfortable returning? Rebecca Wagner, 25248 Southwest Oberst Road, Sherwood. As a parent of a Sherwood 8th and 11th grader and a former district employee, I humbly petition the school board to consider the health and safety of their employees first and foremost at this time. I believe that it is completely unethical for our district to demand a return to in-person instruction until educators and support staff are offered the opportunity for vaccination against COVID-19. Jennifer Price, 18370 Southwest 135th Terrace, Tualatin. It is very important for me that my son, a junior, has the option to attend school in person either part or full time for the third and fourth quarter. He is not thriving academically or socially. He has always had good grades, but with online school, he is having a hard time staying motivated, and as a result, his grades have dropped. I am concerned about grades for his college applications. I completely understand if there are teachers who have compromised immune systems and need to continue to teach from home via video in order to stay safe.
Tyler Robinson, 17020 Cobblestone Street, Sherwood. I appreciate the opportunity to provide comments to the board, and I know that this topic is very divisive. I only speak based on the experience I have seen with having one child learning virtually and the other learning in person in a private school setting. I applaud all teachers teaching virtually, but what each child is learning and retaining are starkly different. One daughter is able to go to private school in person by following all the return guidelines that are placed on all schools, including the Sherwood School District. They have implemented policies, guidelines, and schedules to accommodate these strict guidelines. By doing this, science shows that the risk is greatly reduced, and in fact, the school has not had any cases this year. She is able to interact with peers and thrive in ways I don't see from my other daughter. There is inherent risk in everything we do. All we can do is try to limit that risk. I know as I work where I interact with many different people on a daily basis, and over the course of a week would interact with more individuals than my daughter's school teacher. I applaud Lake Oswego School District and the other schools who are figuring out a way to make these guidelines work and prioritize getting kids back in the classroom. Similarly, Dr. Fauci agrees, as well as the American Academy of Pediatrics, who state the academic, physical, and mental upsides associated with returning children to schools outweighs the risk. I know that the board and the district can come up with a solution to get kids back into the classroom being taught by teachers who are excited to be there and substitute teachers if necessary. Tanya Bohm, 22433 Southwest Abusher Road, Sherwood. As a parent of a sixth grade student, I feel that the kids are being caused more harm with this CDL. The social emotional situation is taking a toll.
Beth Farman, 16933 Southwest Cobblestone Drive, Sherwood. Good evening. I am writing to support our children going back to school. As you know, Oregon is among last of the states and countries to have our children in school. Even California and Washington have some districts attending in-person learning. This has taken a huge toll on their mental health, education trajectory, learning motivation, and personal growth. How are our students supposed to keep up and compete post-high school when they are falling behind daily and yearly? Oregon education typically ranks below average nationwide. By the time our students graduate, they will have attended school a full year less than Washington, not to mention other highly ranked states. With COVID and Governor Brown's regulations, Oregon and Sherwood students are losing skills and motivation by the day while their anxiety, depression, stress, and isolation are increasing at alarming rates. As you also know, through the various studies published by both medical and academia, that schools are not super spreaders of COVID-19. Our children need to be learning with their peers, not stuck in a breakout room on Zoom with a group where no one wants to talk or knows what to do. That is not effective learning. In my opinion, CDL has been about 50% effective for typical students and 0% effective for special education and ELL students. Typical students are getting the messages and lessons, but how they are learning isn't meaningful, and therefore isn't creating the synapses in the brain for retention. Learning from a screen all day isn't impactful and won't stick. In addition, special education students, including our daughter, cannot even access the lessons despite the teacher's best efforts. Teachers are and should be considered essential. In my opinion, they are more essential than many jobs that are still working. The school community has always supported our schools. The Sherwood community has always supported our schools, and teachers are evident by the beautiful new high school and bond, the SEF funding and grants, and the classroom budgets. This is the time to do what is best for students. Isn't that the Sherwood motto? I recently heard the statistic that 75% of Sherwood teachers do not want to return to the classroom. I'm pretty sure that the employees at Safeway or Providence were not given a choice whether or not they wanted to come back to work. Students need to be in school. Teachers are essential. Their jobs are in the classroom, just as doctors' jobs are in the hospital. It has been proven that in-person learning can be done safely. Look at and learn from the many states and countries that have gone before us with success. There will still be the cloud campus for students whose parents are comfortable, which will allow for some compromised teachers to remain at home. Sherwood needs to do what is best for their students and their education. Sherwood cannot allow the union to determine what is best for our students, because at the end of the day, the teachers union does not have our children's best interests in mind. Thank you.
Aaron Odom, 20744 Southwest Trailblazer Place, Sherwood. It is time for our children to start making a path back to in-person instruction. This virus isn't going anywhere. I think there is a way to do this safely. Many other states have done this successfully, and Oregon needs to get on board. I also think that there should be an option for parents who want to keep their kids home for the remainder of the year. That is a choice they should be able to make. But my 11-year-old who is in 6th grade is struggling. He has ADD, and online schooling for him is not an option. He has meltdowns daily. We have had to start seeing a mental health counselor because he is so distraught. I'm struggling. There have been many tears shed, and he needs to be back in school. This has gone on long enough, and we just have got to start back to something. I don't care if it's 3 hours a day. I don't care if it's 2 days a week, but we have to take a step forward. Please take these kids into consideration. Daniel McCusker, 21600 Southwest Royalick Avenue, Sherwood. As a teacher and community member, I would ask the board to not require staff and students to return to in-person instruction until all staff have had an opportunity to be fully vaccinated and all staff and students can be assured of a safe environment, including proper ventilation and windows that open. Currently, there are several general education classrooms in the district that teachers are assigned to that do not have windows that open. The COVID-19 training that is required for staff to complete directs staff to open windows to increase ventilation in their work area. A vaccine should be available to staff in the near future. The district has time to make changes necessary to ventilation and windows before that point. Thank you for protecting students, staff, and community members by following the county metrics, safety guidelines, and waiting for a vaccine. Julie Fairman, within Sherwood city limits. I am surprised by the timing of Governor Brown's announcement regarding reopening schools. We are currently seeing a peak of case numbers and deaths. We have yet to see the effect of the Christmas and New Year's holidays and travel. And we have a vaccine rolling out, which will provide the entire community much more protection in the coming months. So why the rush to open schools? Why now? I understand we all want our kids back in school, but not at any cost. I know there is a lot of community and political pressure to reopen, but I trust you will continue to follow the science, respect the health and safety of school staff and vulnerable community members, and make smart decisions about when to reopen. Thank you.
Daniel Hanlon, 17727 Southwest Heatherwood Lane. Sherwood has been honest and diligent and shown our values by protecting our neighbors, our families, and our children. We have endured for so long through difficult and painful struggles. And this moment, the moment when a vaccine is finally available and we know that soon we will have the option to do this safely, the moment when we are seeing numbers spiking and risk escalating, and a new variant that appears more contagious and has a stronger impact on children, is the exact wrong moment to let our frustrations and wariness get the better of us. Thank you. Don Sword, Pastor, 17091 Southwest Cobblestone Drive. We should not reopen the school for everyone. I recognize some students in various grades and with various needs may need a varied response, but as a whole, no. Teachers, staff, and admin all have their own issues with health and family. They shouldn't have to choose between family and employment when other options exist. Hannah Weber, 17623 Southwest Elderview Drive, Sherwood. I think schools should not push to open yet. Teachers still do not have the vaccine. Cases are high. New strands of COVID are appearing. Teenagers are not responsible enough to wear a mask and follow safety protocols when they all threw fake homecomings. There are other ways to celebrate seniors and other students. Sports are not worth people's lives. Sherwood parents need to realize that staff are well aware people want to go back. They need to empathize and be patient. They are pushing to go back to school now, but if we do, we will be back at the beginning. It won't stay open for long. It will shut down again. Whereas if we are just be patient and wait for it to be safe, we can enjoy school longer. Sherwood parents need to get off their high horse. I would much rather have my senior year in my home safe than in a hospital on a ventilator. And parents need to realize, regardless if school's open or not, things will not be the same for a very long time. Still no dances, sports, etc. Going back only risks students and staff's lives. Sun La, 21178 Southwest Lady Fern Drive, Sherwood. The data from CDC shows that schools is not a main source for COVID-19 to spread. I believe it's time to get the kids back to school in all levels, at least in hybrid form for the first 3 months. I realize the last 9 months closures is necessary, but that also did a lot of harm to our kids, both academically and emotionally. There is no reason for the mall is opening and school is closed. Please open the school now.
Dave Mikowski, 15911 Southwest Baylor Way, Sherwood. First of all, I am not asking that all students return to the classroom, but rather that those students who wish to return to the classroom be allowed to without having to demonstrate any need or meet any readmission criteria such as failing grades, etc. However, my request is that this school board immediately directs our schools to develop and implement a plan to allow students to return to the classroom as soon as possible. My reasons are as follows. Number one, the current remote learning model is inadequate. My 7th grader is lucky if he receives 45 minutes per day of useful learning. I believe most of our students are bored, disinterested, and unmotivated to put in any effort to excel within this remote learning model. Students are at minimal risk if they are exposed to COVID-19. I acknowledge that bringing students and adults together in the schools and classrooms increases the chances of them catching COVID-19 from someone who unknowingly is contagious. But current research indicates that mortality rates for school-age children are extremely low. Number 3, our schools can provide effective infection control. I believe this has been one of the biggest arguments against students and teachers returning to the classroom. However, current research has found that the spread of the COVID-19 virus via contact with surfaces is minimal, meaning schools do not have to feel overwhelmed by the prospect of having to disinfect the building constantly. Instead, schools can focus on implementing the standard infection control practices that our essential workers have been following for the past 10 months. Wearing medical grade masks, not cloth, maintaining 6-foot distancing, washing and sanitizing hands frequently, and monitoring oneself and others for symptoms of the COVID-19 virus. Number 4, students and teachers are able to wear masks at school. Again, there is the argument that children cannot be expected to wear masks. I strongly disagree. After 10 months of dealing with this pandemic, I believe family members in most households are now regularly wearing masks when out in public. I think this new normal has pretty much been established and accepted, and I believe the schools will be able to enforce this requirement. Number 5, teachers will be able to protect themselves from catching COVID-19 by learning and following current infection control practices. I work with a team of 20 people who have been entering and working with COVID positive senior care facilities for the past 6 months. None of our team members have caught COVID-19. We identified risks we encountered during our work and learned to take steps to reduce the risks. In summary, I think the reasons, the excuses schools have presented for not being able to safely provide classroom learning just aren't valid anymore. We've seen other essential workers dealing with the pandemic effectively.
Natalie Pastores, 17091 Southwest Cobblestone Drive, Sherwood. I'm a high school senior, and obviously this is not the senior year I dreamed of. But I will not sacrifice the health of others and myself to see that dream be a reality. Nor will I stand by my future health being discussed solely by parents who will not understand my situation. I personally have family members that are at high risk, and I don't want to put them at risk when there are other options available. Outside of me, it is unfair to subject teachers and staff members to choose health for themselves and their families or a job. Even if the school Even if school reopens, it is not going to be the senior year that we all dreamed of. We will most likely not have prom or a normal graduation. But if we stay home, encouraging the COVID safety guidelines, there will be more of a chance of stopping the spread and having better alternatives to these activities than the options we have after returning to school. This shouldn't be up for debate as we are not prepared to create a safe environment for our staff, students, and their families. Hannah Tran, 16673 Southwest Sydney Lane. We have to protect our teachers and improve our COVID rates before trying to push the opening of schools. Of course, it's a mental struggle for most students to stay online at this point, but we can't compromise the safety of the Oregon population. Angela, 22235 Southwest Mountain Home Road. I seriously feel the Sherwood community is not ready or equipped to support in-person learning at this time. Please consider the safety of your teachers and students and continue to support remote learning. Sydney Lackey, 23441 Southwest Place, Sherwood. Please do not open school prematurely. We are struggling with online school right now, but with COVID cases more rampant than ever and Washington County in extreme risk, it isn't a smart idea and would more smarter to wait. Dana Cowley, 22493 Southwest Timber Crossing Terrace, Sherwood. We are in the midst of this pandemic. It's not over. Just because certain people are getting the vaccine, no one, teacher or student, will be receiving it yet. Cases are skyrocketing. Most students don't follow COVID guidelines. It would be a grave mistake to open schools now. I wouldn't want the school district to have blood on their hands. Adriana Patron, 15640 Southwest Willamette Street, Sherwood. As a student at SHS who is active on social media, I frequently see other students posting content that I would be ashamed to post during a pandemic. They flaunt their lack of precautions, sometimes even at school-sanctioned events such as Senior Sunrise or their own homecoming parties, which I deeply wish the school district would put more effort into discouraging during this dangerous time. And it's incredibly frustrating that it is the same schools back up. I also have little faith in many students' ability or willingness to keep a mask on all day if we were in school. I would feel very unsafe being physically in the school building, knowing many of my peers are so careless with their actions outside of school, and probably would be inside as well. I have high-risk people in my life, and if school returned in person, I'd be constantly fearful that I'd bring home COVID and put their lives on the line. I would be very disappointed in my district if they chose to open prematurely.
Jeff Scarvey, 17161 Southwest Villa Road, Sherwood. As a 20-year Sherwood resident who put 2 kids through the Sherwood School District, and as the husband of a Sherwood teacher, the decision on how to safely serve the educational needs of students in Sherwood is important to me on many levels. I don't think anyone disagrees that in-person learning is the best option, and that should be the goal. It's best for the students, it's best for the teachers, it's best for Sherwood parents, some of them working parents, struggling to work and cope with distance learning for their children. This distance learning curriculum has been stressful for everyone. That being said, the priority should be resuming in-person learning only when it is safe to do so. Safe for teachers, staff, students, and the families of students. An argument can be made that COVID may not be dangerous for children, although we know little about the long-term effects. But this is missing the fundamental issue. Infected kids coming to school pose a risk for teachers and staff, but also to their fellow students and the families at home of those students, including elderly or medically compromised family members. We now have a vaccine, and efforts should be made to vaccinate teachers and staff. We also need to see a significant decline in the number of positive cases and deaths in Oregon before moving to a hybrid schedule and finally full in-person learning. Finally, this is an opportunity to speak with our children and encourage resiliency. This is certainly not the last time in their lives they will encounter struggle and challenge. Why not set an example for them on dealing with it and being better for it? We can safely resume class when it is truly safe to do so. Thank you. Teresa Perkis, 23536 Southwest Redfern Drive, Sherwood. I support going back to in-person or hybrid learning when teachers and staff at the schools have received both doses of the COVID vaccine. Kathy McCodtrod, Sherwood, Oregon. I was relieved to hear from OHA that vaccine access will be ramped up soon. Getting a COVID-19 vaccine is the only safe way to open our schools. As an SSD school bus driver, I believe we need COVID-19 vaccines first. We don't want to put our high-risk family members, students, ourselves, and the community in an untenable and dangerous situation. Thank you. Lisa Jacobs, 13365 Southwest Morgan Road, Sherwood. Reopening schools prematurely would be irresponsible and putting all students, teachers, and families in danger. In-person school is ridiculously unworthy of risking the lives of thousands of Oregonians. It would simply be a horrible idea to reopen schools at the peak of a global pandemic. Our board needs to value the safety and livelihood of its citizens over an immature demand to open schools.
Corbin Bishop, 17043 Southwest Village Road. My brother goes to school here in Sherwood, and I don't want him being put at risk or putting anyone else at risk. Please do not reopen the school district until all of the staff has been fully vaccinated and the virus is more under control. John McLeod, 23774 Southwest Pinehurst Drive. Can and will teachers get vaccinated before you open? Max Libman, 10173 Southwest Lady Marion Drive. I do not believe reopening the schools would be a good idea. As a junior, I understand and relate to the sacrifices made during isolation. We have lost a considerable portion of would-be social interactions, and class is realistically less effective. In that sense, change does not need to be made, but reopening the school is not the answer. First of all, reopening schools will not necessarily solve the previous problems. Regarding socialization at the high school level, students are still communicating with one another through social media and in real life get-togethers. As for education, I honestly don't see a return to school being that much of an improvement, taking into account the distractions that would be involved with in-person schooling. I personally don't think that goals like increased attentiveness, more effective assignments, and better student-teacher interactions are likely to be fulfilled. Secondly, from a health perspective, bringing students back would be a mistake. Although there may be proper precautions in place, certain aspects would still require students to be attentive to their actions. As a student, it's pretty safe to say that not everyone will stay 6 feet apart, wear a suitable mask properly, and maintain proper bubbles away from school. With that in mind, countless students will inevitably get infected. Whether or not all are symptomatic, students will get sick, their loved ones will get sick, and people will likely lose their lives. I would ask you to ask yourselves what the quality of education and happiness will be while in school under these harsh restrictions. As well, I would ask for you to think of how well the district and staff could enforce these rules realistically under the circumstances we are in. While I understand that your task becomes far more difficult at the elementary and middle school levels, I would ask you to remember by opening the schools, you start a 100-to-1 battle. And if you lose, the consequences will be dire. Rhea Bishop, 17043 Southwest Villa Road, Sherwood, Oregon. I want my children back in school. However, if there's a way to wait until the testers can get their vaccinations, we are very close to that. Let's wait until then for better safety overall.
Eric Flister, 22206 Southwest Bashong Terrace, Sherwood. Sherwood School Board, in less than 24 hours, this petition asking you to limit opening to only the kids suffering most has received 100 signatures and counting, hyperlink included. We understand that some families feel they can no longer bear any alternative to in-person school. Let them come back. It is fair to balance the risk by opening school for those suffering most. Special needs kids, kids of essential frontline workers with no childcare, kids for whom remote learning is failing, etc. Let families decide if they fall into these categories, but don't encourage typical families to come back yet. Do not mislead Sherwood about the cost we know opening would exact, counted in lives of our most vulnerable neighbors. Yes, our children are suffering terribly. Yes, they are vulnerable too. You will hear that keeping them isolated risks their lives. But despite rumors and anecdotes, there are hard numbers on this. Has been no increase in suicides, attempts, or calls. The people dying in this emergency are the elderly by a vast margin. That's the ball we need to keep our eye on. Once vaccines are available, the serious insufficiencies of remote learning can largely be made up with extended school hours and summer school. Children and families have not heard how much their sacrifice has been paying off. You need to tell them. It will help tremendously for them to know how effective it's been. Recognition and appreciation will inspire them to keep pulling together for just a few more months. Children and families don't know that the death rates in Washington County are 4 times lower than the US average. Oregon has the second lowest rates in the country. Our sacrifices have been working. Why are our rates so good? The biggest difference is that we were one of the few places wise and strong enough to keep schools closed. Many cite recent studies that claim to show schools do not spread COVID, but those studies are being misrepresented. They all make sure to specify that they only apply when community infection rates are well below ours. Two Johns Hopkins epidemiologists are trying to alert the public to the widespread misinterpretation of the studies. They link directly to the primary literature. Based on evidence currently available, schools almost certainly do contribute to viral transmission, and pretending they don't is potentially dangerous. In many places, school closure had the strongest associations with reduced transmission of all control policies. The association is so strong that it strains credulity to claim that schools play no role in driving viral spread. Hyperlink concluded. The latest studies show that schools increase COVID spread when community infections are at 35 to 140 new cases per 100,000 per week. Sherwood is at 172. Hyperlink concluded. If we change policies to look like the rest of the country, we know to expect that our
Madison Urban, 23981 Southwest Redfern Drive. I'm a junior at Sherwood High School and understand the extreme importance of getting students back in school. I mean, even I don't enjoy doing online school whatsoever and have many options towards that matter, many opinions towards that matter. Although it is not ideal whatsoever, and yes, there will always be opposition to controversial topics such as this, if the Sherwood School District were to let kids back into school, the fear that the decision was rushed and not truly thought about, parents will begin to question, if they haven't already, how well it was taken into consideration of all of the aspects to keep students safe. I realize one argument to this controversial topic is the question from adults about if going into grocery stores and public malls, etc., are okay. Why shouldn't kids be allowed back in school? The difference is that when in a grocery store, you may simply pass by someone every now and then, as in many of other stores as well. In school, classes go on for long stretches of time, the same students being near each other for an hour on end. Reliable information is hard to come by these days, but we do know that research has shown if you are around someone for more than 15 minutes, the risk of exposure increases exponentially. That is the difference. Beyond the variable of time, the more people you have in an enclosed space, the less control you have over proper mask wearing. I can almost guarantee, at least at the high school level, that not only because the school is so big, but the amount of students attending SHS and simply just being high schoolers will be extremely difficult task to regulate mask wearing. At SHS, there's a focus on optimism and creating a positive environment. But based upon past experiences and how vocal and opinionated high school students can be, although not always a bad thing, I do like to admit it, but high schoolers and middle schoolers as well will be stubborn and make it a challenge to make everyone keep their mask on. Even if we are told all the right things, people will take their masks off in the bathroom, wear masks under their nose, etc. This has a major potential to cause a spike in cases, causing all students to go back to online learning. Some students are great about it, and I have much respect for those people, but that road can be a very dangerous road to take, Another aspect to take into account is that the sooner schools are placed in session, the higher risk at some point having to close the schools again and going back to online school because of the severity of the pandemic currently. I really appreciate you taking this into consideration, and I understand there are plans to manage these things, but I urge you to carefully consider every single aspect of every single student situation before making a final decision. Through all of this, talking to my own peers in multiple grades as well as adults, many have said they are lacking faith in the Sherwood School District, but would never admit this to anyone within the administration or the Sherwood School District. So I ask this reasonable request. Please consider the situation, not just the effects on staff, not just the effects of the students, but the effects it has to the Sherwood community as a whole. Emma Kane, 17242 Southwest Carlson Street. I believe going back to school is not going to help the situation of any of the high school students who are desperate to go back to school. As much as I miss in-person classes and my peers, I still am worried as to the way our teachers and students will be able to keep within the COVID-19 guidelines. James Crabtree, 17038 Southwest Cobble Court. Do not be bullied into opening schools prematurely by parents who are tired of online school. Online school is tough on everybody, but necessary to ensure the well-being of students and staff at Sherwood schools.
Draven Ford, 21584 Southwest Granary Place, Sherwood. Reopening schools before we've achieved widespread access to a vaccine for those who choose to take it would be a gateway to unraveling every iota of safety and containment we've all worked so hard to achieve over the last 9 months. This pandemic is not over. COVID deaths are higher now than they have ever been. We need to be putting more effort than ever into social distancing and stopping the spread because the virus is still here and it kills thousands more people every day. Keeping our circles small is pivotal in keeping our communities safe. There are 5,345 students in the Sherwood School District, hyperlink included. And opening in-person schools, directly or indirectly, expands your web of exposure to all of them, as there is no way for us to eliminate the possibility of student-to-student transmission. No amount of precautions or protocols will change this. No student will wear their mask the whole day through, and your well-behaved, raised right child is not an exception. Children are expected to stay on school premises for 6+ uninterrupted hours every day. In that time, among thousands of individuals, masks will inevitably fall off, get lowered for an itch, get pulled off by other antagonistic students, likely be completely removed during lunches and other unsupervised breaks, and more. And this is assuming everyone is wearing them right to begin with. Aside from being a slap in the face to every family who has struggled and is continuing to struggle with all of the challenges put forth by this pandemic, opening schools would mean that online education is no longer a valid option. This means that whether or not a family is comfortable with it, they would have to send their child off to an enclosed environment of hundreds, if not thousands, of potential carriers every day. You may not have an at-risk parent or an immune-compromised spouse to worry about at home, but someone does. Forcing them to choose between their safety and a proper education for their child is downright immoral. Currently, there are too many variables at play for us to create anything resembling a safe school environment. If you prematurely push to reopen in-person schooling, you're demonstrating that you don't care about the health of your community, your family, or your child. Lindsay Boisvert, 23291 Southwest Shirk Place, Sherwood. Despite the negative effects this pandemic has had on our education, student and community health needs to come first. Even with tons of preparation on the school's end, there is no guarantee that students will maintain safe distance and behave appropriately enough to keep everybody safe if we return while COVID is still a threat to the community. Many people in Sherwood have high-risk parents or siblings, and it's not fair for those students to have to put their families' lives at risk because some people are tired of doing school through Zoom. Amelia Leon, 16100 Century Drive, 191. In my opinion, I think we shouldn't go back to school since there's a lot of students who are not following the quarantine rules and it might increase the COVID cases. Ashlyn Miller, no address listed. This is only going to raise COVID rates. put us back into lockdown, and make everything with online school even worse. It is just not a good idea right now. We've waited this long. We're so strong. We can push a little further.
Lou Zangara, 23792 Southwest Stonehaven Street. What are the solutions available to teachers and administrators to take actions towards students who continually violate social distance protocol? Secondly, classroom clears were becoming more frequent at elementary schools pre-COVID. How will this be safely handled? Jarrett Seeley, 20970 Southwest Edie Road. Do not open schools. People aren't following regulation. It's not safe to go back. Connor McDonald, 19340 Southwest Murphy Street, Aloha, Oregon. Despite my address being in Aloha, I would like to make it clear that I graduated from SHS and spend a lot of time in Sherwood still. In a time when hundreds of thousands of lives have already been lost and may yet be lost in our country due to national mismanagement of the COVID-19 coronavirus pandemic, possibly the most destructive thing to do would be to reopen the Sherwood School District for in-person learning. To reopen the school system as such, especially on the eve of a widespread vaccine distribution, would be to negligently put at risk the lives of thousands of students and staff members throughout the district. And make no mistake, while thousands may not die or receive severe complications as a result of the spread of the virus, dozens will. Not to mention how far it will spread to families outside the immediate school system as a result of enhancing that disease vector. For the sake of the lives of the people of Sherwood, do not reopen schools for in-person learning yet.
Jack Stoddard, 16500 Parrot Mountain Road. Coronavirus is higher than ever. Why would we even entertain the thought? If we are risky now and it bites us in the butt, we will be at home for another year. Page at 17256 Southwest Noble Forecourt. Schools shouldn't be reopened. Thanks. Allison Worthy, 2186886 Southwest Vinter Lane, Sherwood. Schools should remain closed while case counts are high. Transmission of COVID among students has been rapid in other states and nations that have opened schools too soon, and although most kids recover, some do not. We've all read accounts of the many long haulers who are still experiencing breathing problems, cardiac arrest and arrhythmias, psychological symptoms, and crushing fatigue, to name just a few of their ongoing symptoms. The risk to our kids and family members they transmit it to isn't worth it. While there are big social impacts that result from staying home, the alternative, death or long-term illness for students and families, is undeniably worse. Melissa Gall-Remick, Southwest Cedarbrook Way, Sherwood. Multiple high school teachers today, on only the third day back to virtual learning, canceled classes and directed students to watch the live stream of the U.S. Capitol armed insurrection, looting, and shooting in place of class. This is unconscionable. Yes, high school students should be aware of the workplace violence and assault on the nation's Capitol building happening, but they should not, however, lose access to core education, plus lose all emotional support from peers and teachers desperately needed while streaming violent images. In addition, teachers are so tone deaf as to not realize some students' parents, family members, and family friends show up to work in government buildings all day. These youth, like my son, can't help but transfer this to their parent or family member, may also be attacked, shot, and killed in their workplace. These teachers forced upon the students multiple layers of trauma in place of providing education and a safe place during the school day. Sankalp Patil, 23819 Southwest Huron Lakes Drive. I understand how desperate people are to get back to in-person learning. Trust me, as a high school senior, I can sympathize. But going back to school right now won't solve anything. We've gotten almost halfway through the year online, and I feel like moving to in-person would just become really messy. Safety is more important right now than social traditions. We just need to hang on until next year or until vaccines are widely administered.
Hannah Edelstein, 23773 Southwest Scott Ridge Terrace. I am a senior at SHS this year, and while I'm saddened that this has not been the senior year I wanted, I understand that going back to school is not appropriate. There are far too many risks going back, and I urge the school board to keep us online for the remainder of the year. Corey Whitwell, 2939 Southeast Taylor Street, Portland. This is still a pandemic and people are still dying. We need to fix this first. Victoria Mexicano, 21792 Southwest Sherwood Boulevard, Apartment 219. We have to continue to take our precautions and understand that these things are serious and take time. Of course, I would love to go back, but now is not the right time. Not only will we be risking our health, but others too. Our teachers, special needs, genders, etc. The less of us being exposed to one another, the faster the time will go by, with fewer cases and hopefully reopening our schools by next year. 1 year will do us no harm. Laura Johnson, 22304, Southwest Dewey Drive, Sherwood. I'm a student at Sherwood High School. Since March, I've been following every guideline, wearing a mask and staying away from group gatherings. In that regard, I'm afraid many of my peers cannot say the same. Despite the new year, COVID cases have spiked during the past months. I implore you to see reason and seriously take into account the safety of students and their families. It is impossible to ensure our safety in these conditions, especially when we are simultaneously being exposed to the virus through work and other activities. My family has already been hurt by COVID. Please don't put us and others at further risk.
Katie Flacker, 16868 Southwest Cobblestone Drive, Sherwood. Dear esteemed school board, as parents of current sixth grade Sherwood Middle School students, we want to applaud all of the efforts made by the amazing teachers and staff to help our twin boys continue to thrive in their education and feel connected to their new school community, even within this online environment. As fellow educators in a nearby district, we see all of the hard work the teachers have put in to allow for important community building time within the online sessions, as well as the continued rigor in their subjects. Even though our boys would much prefer to be in school with their peers, working collaboratively and sharing those awkward middle school experiences we all go through in person, they also understand that these very unique circumstances will not be forever, and our efforts are based in our family values for the greater good. We know our experience may be different than others, but it doesn't discount that we have had an overall positive experience with online learning, and that needs to be shared as well. From a professional standpoint, I have some wonderings about what the impact of possible in-person learning will be for the staff of our district, as well as all of the students, in person or online. As it stands now, middle school teachers are to manage both groups of students, and if an outbreak occurred at school, the required quarantining process would impact not only the teachers for the in-person cohort, but also the online program. In schools across the nation that have opened up, so many teachers and staff members are sick, quarantining, or have stepped down that many schools trying to remain open or to reopen just do not have the personnel available to do so well. Keeping enough staff in schools for supervision is becoming a real concern. It is especially difficult and impossible on some days to have enough licensed teachers in classrooms delivering quality instruction. In a Reuters survey of 217 districts across 30 states, about half reported significant staffing issues, and this was before Thanksgiving, Christmas, and the arrival of winter. I worry that if the main reason for families wanting in-person learning is to have a better education, we will inevitably have situations arise where personnel will be instead supervising students in school rather than providing the excellent education our professional teachers have been trained to do in person or online. The reason for the shortages is simply that the virus is too widely spread. With so much spread, a significant number of teachers, nurses, bus drivers, food service workers, custodians, and other staff in any given district will inevitably catch COVID-19 or be exposed week after week. That's bad enough on its own, and depending on a district's particular policies for quarantining, contacts can further multiply the impact on a whole school staff. Just how much
Ollie Neal, Portland, Oregon. It's not safe to open schools without the state receiving and giving vaccines. I'm only 18, and if I were a parent, I would make sure my children are safe and vaccinated before returning to regular school. Claire Pierenboom, 17415 Southwest Woodhaven Drive, Sherwood. Dear Superintendent Cordy and Sherwood School Board, I have recently been made aware of a petition voicing the support to move to in-person learning by many students and families. The voices this petition is amplifying are loud and come from some of the most privileged people in our community. Those are not the voices that need to be heard in regards to COVID-19. COVID-19 disproportionately affects families of color and other minorities. It will be a blatant display of white privilege to open up our schools so prematurely. Before we move ahead to open our schools, we must run our plans through rigorous equity filters 17415 Southwest Woodhaven Drive, Sherwood. Dear Superintendent Cordy and Sherwood School Board, moving to in-person instruction too quickly is dangerous for our teachers and community members. In order for a safe return, teachers must have the opportunity to be vaccinated. Due to the slower than anticipated rollout of vaccines, we must be prepared to wait until all the teachers have the opportunity to be vaccinated. Additionally, a large portion of the student population at SHS has disregarded the COVID-19 regulations as seen through the intense community spread over the last couple of months. Thus, the other students would be put at risk attending school with these classmates. There are student voices missing in the petition and this conversation tonight. Whether students don't know how to voice their opinions here or social pressures keep them silent, many students have these same concerns. In short, speeding up the transition to in-person instruction is dangerous and irresponsible. A concerned SHS student. Cam and Gwen Hardy, 22525 Southwest Smeltzer Road, Sherwood. We'd like to thank the school board for working hard to provide an effective alternative to in-person education. Will the school ensure that they provide the necessary PPE for all students and staff, and ensure that the use of the PPE is enforced and provided the necessary sanitation as approved by the CDC? In light of the COVID-19 variant strain that is shown to be more transmissible, what safety precautions are necessary to keep the students and staff safe? All teachers and staff should be vaccinated before schools reopen for their safety and that of the community. Derek Gregory, 23427 Southwest Greengate Place. By returning children to in-person school, we are blatantly ignoring all COVID guidelines and putting children, as well as their families, at risk of a virus that has already killed over 1 in every 1,000 Americans.
Janice Hayes, 17682 Southwest Wapato Street. I am not only concerned about the well-being of my children, but the mental health of all students. My children are doing excellent in school due to the fact that my husband is retired. Other students, however, are either not being supervised by adults or have adults at home not capable of helping the students. There are children out there suffering mentally over the lack of socialization and normal routines. Over 20% of high schoolers in the Portland public school system have a minimum of 1 F. I am afraid if we continue down this path, we will have a similar situation in Sherwood. Trevor Sue, 17611 Southwest Elderview Drive. It is not safe for Sherwood to go back to school. Hundreds of thousands of people are dying. There is no possibility to go back to school safely yet. Karina McNutt, 23559 Pine Street. We have to put the safety of others before one's individual request. I get that it's difficult for many to lack the physical interactions most students are used to when it comes to learning, but it's selfish and insane to ignore a deadly virus that has shown increased in cases and casualties in comparison to when schools were let out in the first place. Furthermore, it shows a privilege to even consider public gatherings in a time where loved ones and members of the community are at high risk every day. You have to accept that even if in-person school is restricted to students who choose to participate, it will still spread germs. If not to other students, to others of the community. Though there are students who have real troubles with online school, like bad internet or a crowded house. However, if those were truly in the concerns of those attempting to crowd into the building again, they would surely come to the conclusion that any spread of disease would only lead to an increase of troubles for those who have those difficulties. Please, for the love of God, think of others in these times, because adults in charge have to be looking out for the safety of students and the community. Think of the nurses, first responders, and the thousands of Americans who have lost their lives or the lives of those they've loved. Thank you for your time and consideration. Andrew Below, 22741 Southwest Lincoln Street. By going back to school, we would be risking the safety of every student, parent, and faculty member at SHS, all for a sense of false normality. We are in the peak of a global pandemic. Chair Allen, with the exclusion of anonymous submissions, that concludes public comment.
Thank you both for that impressive display of comment reading. Really appreciate that. Thank you for everybody who submitted public testimony for us tonight. I also appreciate everyone who has individually emailed us. And I do apologize for the fact that ordinarily when we receive emails as a board, we do respond to those in some fashion. The volume has made that anything other than a canned response that I think would probably be unsatisfying to people. So, but know that your emails have been read by each of us. I think through listening to that, we know that if you have come looking for a place to make decisions that will be universally popular, this is the wrong meeting, or the wrong set of meetings. What we're going to do now is we're going to have a series of, I think, 6 different discussion topics that staff will move through. Because they are such important partners in being able to successfully reopen school, we have asked representatives of our bargaining units to join us as part of this meeting. They'll have the opportunity if they'd like to ask questions. And at the end of the meeting, I think we'll have an opportunity for each of us if we want to make any observations or reflections or anything like that. In the interest of folks that are watching this streaming, I'm not planning on taking any kind of a break. And so if you need to step away, let's just go ahead and do that in the ordinary course. And with that, unless there are any questions, I'll go ahead and turn it over to Dr. Cordy.
Good evening. Thank you, Chair Allen and Ms. Andrade, Mr. Rose. Thank you for reading the public comments. It's much appreciated. We will get to the 6 topics that our team would like to talk about this evening. But before we do that, I just have a few thoughts to share. Since the middle of March of last year, our experiences as educators, regardless of what position we serve in, have changed in ways that we likely never could have imagined nor would have wanted to imagine. That being said, and through all the twists and turns and fears and uncertainties, the teachers, classified staff members, and administrators of this district have remained focused, no matter how challenging it has been, on how to keep education happening for our students, how to create supply pickup events, to get technology into the hands of our families, to continue to provide meals, keep facilities clean and safe, and the list goes on. Since last March, districts all across the state have continuously responded to changing guidelines within an impossible scenario where the best of intentions have been coupled with the fact that none of us have the knowledge or experience to know what education can and should look like during a global pandemic. Everyone has done their very best. Sherwood families, like families across the nation, have been faced with how to work from home, if their jobs allowed for that, while providing hands-on help to their children as they learn via comprehensive distance learning. Other families have been faced with continuing to leave the home for their employment and the challenges that creates, while yet others have lost their jobs and indeed wonder how bills will be paid and food provided for their families. Through all of this, all of us, families and staff alike, have dreamed about a day when students and staff can be brought back into our schools in a way that is safe. Over the course of the last 9 months, while our teachers and staff have been working hard to implement comprehensive distance learning, we also have been working diligently to prepare for when some students and staff might be able to return. As we've heard in public comment this evening, in our community alone, there are multiple perspectives about the topic of reopening. Petitions being circulated that support opening and others that do not. Within our district, we have staff members who are supportive of coming back soon, and others with family members or they themselves who are in high-risk categories and are fearful of coming back too soon. I very recently read an email from a teacher who is so passionate about teaching, about her students and their families, and is a cancer survivor, worried about what this might look like for her and her family. There's no simple solution. There's no straight path forward. But if we all work together, I am confident that we can get there. This evening, we'd like to share with you some important information about safety plans and about what that preparedness has looked like. Any specific dates or speculation about dates is not the objective of this evening, as noted earlier by Chair Allen. There are 6 areas that we'll be discussing tonight. Number 1, Ready Schools, Safe Learners Guidance. That's also referred to often as RSSL. So when you hear that acronym, that's what we're referring to. The second area, facilities, cleaning, and PPE. The third area, transportation. The fourth, staff support. The fifth, limited in-person instruction. That is also often referred to as LIPI. And the sixth, the elementary hybrid model. As each topic is discussed, after each topic is discussed, we'll answer the board's questions and then move on to the next topic. So I will go ahead and introduce Mr. Gary Bennett, our Assistant Superintendent, to talk about the Ready Schools, Safe Learners Guidance. Mr. Bennett?
Thank you, Dr. Cordy. Can you hear me okay? Thank you, Dr. Cordy. Good evening, Board of Directors. I wanted to talk tonight about Ready Schools, Safe Learners, the guiding document that provides us with parameters on which we can open schools safely. We've talked about this a little bit before, but I wanted to go back over it, not only to talk with you about some of it, but also people who might be listening at home. So there's several parts to the guidance. The major parts of the guidance focused on the health and safety of staff and students. There are also parts of the guidance that deal with parameters from a teaching and learning perspective, things like instructional hours, what an instructional day looks like, family engagement, mental health, and social health. The guidance we want to talk about tonight are the sections that really focus on health and safety. And these were put together in partnership with the OHA, Oregon Health Authority, and Oregon Department of Education. This guidance has evolved over time as we, and when I say we, I really mean epidemiologists, have learned more about how COVID-19 spreads and how it works in the community. As a district, we have been preparing to implement this guidance since the early days of summer when the first versions of this document came out. This is not something new to us, and it's not something we're just diving into. We've been looking at this for quite some time. And in order to be in compliance with the guidance, all school districts had to submit by August 15th to ODE what's called an operational blueprint for each school in the district. And that operational blueprint for reentry, it's over 20 pages long, and it requires us to develop detailed plans on how we'll reopen schools to keep staff and kids safe. Each time the guidance is updated, we have to update the blueprints, and we've been doing that each time the guidance comes out. We go through and we've updated our blueprints and kept those current. The guidance has gone through several revisions, and as Director Allen mentioned earlier, currently under yet another revision. We imagine that will be a sort of an evolving cycle as we learn more about the virus and the conditions change. But I did want to talk about what the guidance covers, just so people know what's in there in a more specific way. There are several sections. It's very extensive. It's 89 pages of text, just the initial document, and then there are several supplements that are 10, 20, 30 pages each that lay out the detailed plans for what the safety protocols are for schools. There's public health protocols, a whole section on that, and that deals with everything from physical distancing, cohorting of kids, keeping the number of kids that kids come in contact with within a given day, and limiting the number of kids staff come in contact within a given day. There's entry and screening procedures. There's protocols for isolation and quarantine, things of that nature surrounding public health. There's a large section on facilities and operations that gets into everything for cleaning protocols, limiting time in hallways, hand washing and hand washing stations, arrival and dismissal procedures, guidelines for classrooms. One of the big ones is we have to have 35 square feet in every classroom for every person that's in there, not just every student, but every person that's in there. We have to subtract the furniture, for example, out of there. That's 35 feet of usable space. There's guidance on playgrounds and recess, meal service, transportation, ventilation, emergency drills, and the list goes on. And then there's a whole section on responding to cases when they occur. It's got several sections in preventing an outbreak, responding when cases arise, and then planning for reentry. And it's a fairly detailed process. As Director Allen said, it's been based on what they've seen other places successful in the country. And it's been evolving over time as we've learned from that. It is important to note, and this was mentioned a little bit in public comment, but I definitely want to refer to it and just make sure that we're all clear on this. is that with all of these procedures in place, school will not look like it did when students walked out of school in March of last year. While we're in a pandemic, when and if we do offer, however we offer in-person instruction, it will look different. Students will be socially distanced. Time in school will likely be shorter. Students in most grades will not be in school every day, and at certain grade levels, they may be in person very little just because of the number of students at the school and the nature of the schedule. They won't see students in other classes like they normally do because we'll keep kids in cohorts, having them contact the fewest number of kids. That's a major path to safety, but it's also a major change for kids. And these restrictions may sound harsh, but they are the restrictions that make the guidelines work, and they're the restrictions that keep us safe. And so um, places that have followed these protocols have been successful in limiting the outbreak, and they're designed to keep students and staff safe while they attend in person. But I just want to be clear that school will just look different under these guidelines until the pandemic comes to a close. So with that, before we move on to the next section, I take any questions the board has on this topic.
Go ahead, Mike.
Just, oh, sorry. Uh, I'm a little concerned, I mean, just, can you just say a little bit about what's gonna happen? The guidance are gonna be updated on January 19th. And it seems that, some, school districts need to make decisions, at least start to make decisions before then. Can you give us a roadmap into what might be in those, January 19th guidelines?
Yeah, I can. And usually I try to be really careful to keep my board role separate from my work role, but I'm going to rely on, what I know from my work role at the health authority right now to talk about this. The primary guidance the governor gave was for us to look at the numeric metrics of what are the case rates that are considered safe to come back to school. This would be the third revision of those metrics since they first came out. When we first developed those metrics, we were certainly the first state in the country and maybe one of the first jurisdictions in the world to actually pin down what those measurable metrics were for people to come back. And we didn't have it, so we didn't have anything to, somebody else's metrics to go look at. We really had to do that from scratch. And so we looked at case rates in other parts of the world, frankly, that where school was in person and cases weren't spreading rapidly. What's happened over time, and you've heard actually some really good comment both ways, that there has been emerging science that has given us a better understanding of what is and isn't safe. It is sometimes overcharacterized in terms of what that science says. That the science doesn't say everything is great, bring kids back to school, there's no problem. But that line has in fact moved over time. And so in October, I think it was October, we adjusted the metrics. And now we're looking at the metrics in the neighborhood of what the state of Washington has done, which is based on what the Harvard Global Health Program has recommended. It can feel, I know, like those metrics are sort of, well, we can't meet them, so let's make them a little looser and see if we can meet those. But that's really fundamentally not been the case. They've really been driven by our evolving understanding of where the risk lies. There may be some other relatively minor updates in the guidance, but to the things that Mr. Bennett talked about, I don't expect to see significant change there. I do have one question, if I could, and I can't remember if it's a separate topic we're going to talk about, but can we talk about ventilation at all? Is it a separate topic?
Yeah, the next topic will be all about facilities, cleaning, PPE,
Okay.
ventilation will be a part of that.
Great, got it. Jessica.
Yeah, I just thought it might be useful for folks that are watching online who may not be familiar with what an epidemiologist is. These are really fun people that in my work life I get to talk to from time to time, who are among the most apolitical people I know, have ever met. They are scientists and disease docs whose entire focus and study is on how to prevent transmission of disease. So when you hear that these guidelines were put together by epidemiologists, I really think that gives me great confidence because those are folks that are really focused on what is the best way to prevent disease transmission so that if you have people near each other or sharing space, how do we prevent someone getting sick or getting somebody else sick or doing so unintentionally? So these guidelines that have been put together, the Russell guidelines, if you will, Ready School Safe Learners, I have high degree of confidence that the guidelines itself, but also the metrics that go along with that are being developed in a way that's entirely focused on how do we keep people safe? What is the science actually telling us more than should we move them to move them? It's about what are we actually learning as people have implemented different approaches, and what does the evidence show us at the end of the day? And I think that's really super important to understand that these are very much science and evidence based.
Thanks. Other questions or comments before we move on to the next section? All right.
All right, thank you. Next, I'd like to introduce Mr. Jim Rose, our Chief Operations Officer, and Mr. Ken Bell, our Director of Facilities, to talk about the work that has taken place relative to facilities, cleaning, and PPE.
Thank you, Superintendent Cordy. Under the Ready School Safe Learners guidance that Gary just spoke to, schools must submit a plan to provide on-site or on-site or hybrid instruction. And these are generally referred to as the operational blueprints. Our first blueprints were completed in August, and with each revisions of the Ready School Safe Learners guidance, the blueprints are revised. The most recent revision includes the December 4th guidance, and these blueprints are all 20 plus pages long and address a variety of topics related to opening the schools. In all, there are more than 25 individual topics to address, with many subpoints in each topic that have to be tended to as well. Each school had a team of both at the school level and the district level to assist in the creation of their blueprint, and the blueprints are all on our website and available for folks to review if they wish to. I'm going to ask Ken to cover a number of topics related to our buildings and personal protective equipment. So Ken Bell, please.
Thank you, Mr. Rose. Over the past 9 months, our teams have worked tirelessly to not only complete all of our bond work and deep clean our buildings, but to prepare for the safe return of our staff and students whenever that is. This preparation has included a comprehensive health and safety plan that seeks to create the safest teaching and learning environment possible. In order to prepare our buildings, we have completed the following tasks in addition to some other things. We've upgraded the majority of our HVAC filters from MERV 8 to MERV 13, which is the highest possible rating that our systems are able to run. We've reprogrammed our HVAC systems to maximize the amount of outside air being circulated at all times. We've deep cleaned and fully sanitized all of our facilities and equipment. We've created and trained our custodial staff on protocols for proper disinfecting and sanitizing, including all touch points and hard surfaces every day. We've purchased a trowel cleaning system for every teacher that will allow them to effectively and safely clean desktops during the school day, including before and after lunch. We've created isolation rooms for students who feel symptomatic and outfitted staff with full body PPE and room air purifiers in order to keep staff safe. We've purchased and issued 2 cloth masks and 1 face shield to all staff members. We've purchased KN95 and other types of PPE for any staff who requests it. In addition, these have done a number of other things that we believe will help keep our students and staff safe when and if it's time to return. Thank you.
One other key area that's in the blueprints is cohorting. And while our buildings have been closed to the public, we've been using an online and paper-based system to track who's in our buildings, when they are, where they go in the building, and who they come into contact with. Once we bring students back, this process becomes much more complex as we have specific rules related to how many students can be in a cohort and how many cohorts they can belong to. We will be reusing a variety of tools, including our student information system known as Synergy, Synovia, which is our transportation software that helps us do our bus routes. And then also probably a variation of the current online and paper-based system that we use. Combined, these pieces should be able to give us the information we need to provide our nurses with the information they will need to respond to any cases within our school. So the blueprints continue to evolve, as you just spoke about. The next guidance will come out on January 19th, and I would anticipate that we get to review each of those blueprints again at that time.
Thanks. Questions on facilities operations? Hearing none. Next up.
Okay, thank you, Jim and Ken. Next, we are going to hear from Ms. Miller, supervisor in our transportation department, and she will talk about the safety protocols that are in place once we are able to transport students. Ms. Miller.
Thank you, and good evening, everybody. Thanks for the opportunity for us to talk about what we've been planning over the last few months to prepare for kids coming back on our buses. We have had trainings, many trainings with drivers, and have developed protocols for cleaning processes, which involve wipe down of touch surfaces between every route and a thorough disinfection every afternoon after the buses return to the lot. We have plans for student screening, which we have a protocol for that, and the drivers have been trained on it for visual screening of students as they board the bus. That masks are required, and contact tracing logs will be filled out by the drivers at arrival to the schools and departure from the schools. And we've also trained the drivers on isolation measures should a student have symptoms while they're being transported on the buses. We have figured out our seating capacity based on staggered seatings, which gives us a capacity of 24 to 30 students, depending on how many family members we can sit together on our buses. And as part of that, it became one of our concerns was how are students going to understand where to sit on the buses. So we've designed and installed magnets on all the buses that shows which seats are to be sat in and which aren't. We are working on ventilation plans so that we can crack windows and have more ventilation as the bus is moving down the road, and working on that balance between fresh air and comfort for the students as they ride to and from school. And drivers are going to be required to wear masks. They're required to wear them now during the nutrition services routes and anytime they're in buildings. So they've been trained on that. They also have the option of wearing a face shield during loading and unloading times when student contact would be closer for them. We have purchased individual hand sanitizers for their lanyards so that they can use hand sanitizer on their way onto the bus and when leaving the bus and in between any student contacts. And we've had driver trainings. We've concentrated on a lot of driver training over the last few months, some of which is on protocols around COVID-19, but also student management and bullying prevention, the concern there that's coming back, those incidents might be increased. And so we've given our drivers lots of training around that.
Any questions on that topic? Jessica?
Yeah, are there current rules about, I should know this, so I'm gonna embarrass myself asking this question. Are there current rules about not eating or drinking on buses?
For students?
Yeah.
Our policy is that students are not allowed to eat or drink on buses unless there is a medical need for it, or we allow it on field trips and those, and on hot days, water and that sort of stuff. The idea is we're afraid of choking hazards and that
Yeah.
that sort of stuff.
That's great. I just was really curious about that because obviously if we can keep kids with masks on and not choking down a granola bar on the way to school, that would be real helpful, not just for
Very good
children,
point.
but for,
Yes.
you know,
Well, yeah, taking masks off is the biggest risky behavior. Other questions? All right.
Okay, thank you, Sandy. Our next topic is staff support, and our Executive Director of Human Resources, Steve Emmert, will share with us some information in that category. Steve?
Thank you and good evening. Many of the examples that I would have shared, I think have already been shared by our colleagues, but there really are a few areas that I know have been concerns among our staff members that I'd really like to spend a little bit of time talking about. One of the questions that we've heard is how we will ensure the safety of staff in terms of contact tracing. And so as a district, we set up a contact tracing COVID team. And anytime there's any kind of an exposure, whether it be student or staff member, that is sent to the COVID team. That team is made up of a few district leaders and our district nurses. And we work together to make sure that we have contacted every single person who potentially was exposed. We work with Washington County in terms of quarantine, whether or not quarantine, the length of quarantine, how long that needs to take place, testing and testing results. And then we also talk to staff about leave availability. And so that has seemed to be very effective. The sign in, sign out, whether it be QR code or hard copy sign in, sign out sheet has also been very effective in terms of knowing who's been in our buildings every single day and who they've been in contact with. And so that has worked really well. Our nurses have worked very hard partnering with us, making sure that we've been communicating with all of our staff members. And so far, we've been very fortunate in that exposure that we have become aware of among our staff members has very rarely happened at school. It's almost always been like over a weekend and off campus, and so as I said, we've been fortunate in that way. Another concern that I know we have heard about from some staff has to do with immune compromised staff members and those who feel like for one reason or another they would not be able to come back. And we have all along run our ADA process and OFLA-FEMLA leave process with staff members who have those kinds of concerns. And regardless of what kind of education we're delivering to kids, that's something that we're always, we are always doing with our staff members because their safety is extremely important to us. And then I think the last thing that I really wanted to touch on just really quickly is we recently put together in English and in Spanish a COVID online training for our staff, and many of our staff members have already been online taking that, but that's something that we knew was very important for our staff to be able to have access to prior to coming back and working with kids. And so I just would want, I guess I would want all of our staff members to know that when the day comes, we've been hoping for a long time that we could bring kids back and educate them in person. And when that day comes, we are committed to doing everything we can to keeping our staff safe.
Thanks. And if I could just briefly add, you touched on testing. The Health Authority has rolled out a school testing program that provides testing supplies to districts to be able to assure that any kid or staff member who's in contact with a case is able to be tested. And so we're able to surround that, potential exposure pretty aggressively. And so that's now supplied and provided for as well. Oh, yeah, Mike.
2 questions. Follow up just on what you said. So will testing be done at the school? Will those supplies be available at each building?
Yes.
Okay, thank you. Question 2 about which was mentioned a lot, vaccines. I know there's a top tier healthcare workers and there's been various means of trying to get people vaccinated. When will teachers be vaccinated? I mean, when do you think that will occur?
Yeah, right now, the general guidance the health authority is providing is likely sometime in the second half of February. That could be variable based on geography. Some communities may be able to work through the first tier faster. Education employees, not just teachers, but
Yeah, yeah.
transportation workers, nutrition workers, custodians, all that.
Right.
Are the governor has directed that they be the next group that's eligible for the vaccine after the healthcare workers and long-term care residents. But that's sort of our working timeline. That could be plus or minus. It's based on a whole lot of factors that are hard to control for, but that's what our guidance is right now.
Thank you.
Other questions? All right.
Okay, thank you, Steve. The next topic is limited in-person instruction, and this conversation will really focus on first an overarching description about LIPI and some of the work that has been done generally so far, and then specific information from Ms. Funderhyde, principal at Sherwood Middle School, and Mrs. Barron, principal at Sherwood High School, about the specific work and the plans, the big picture plans, hopes about moving forward as it relates to grades 6 through 12. So I'd like to turn it over to Mr. Bennett to start this part of the conversation.
Thank you, Dr. Cordy. So limited in-person instruction, we've talked a little bit about this before, but you might remember it's actually created as an exception to the metrics. And so if you're not meeting the metrics, it allows for some limited instruction in person for kids who really need it. It's not intended to replace core instruction. It's not intended to be core instruction. Instead, the intent is to bring in students to get extra support who simply just cannot access their education online for whatever reason. And so some examples we've talked about are students experiencing homelessness, our emerging bilinguals who are using a new language, some required assessments for special education or English language proficiency that need to be done in person, and other functions that simply can't be done not in person. There are some, it's called limited in person for a reason. It's relatively limited. The cohort size, kids, you can only have 20 students in a cohort, and they can only interact with 2 cohorts of 20 total, and that includes transportation to and from school. So one cohort of 20, you can't ride them on different buses, and they can't be in 3 cohorts even with 2 different bus rides. And so there's some pretty strict limitations around that. They can't be in the building for more than 2 hours at a time, and there's some pretty strict limits on how many cohorts staff can interact with and what that looks like. We've been working on this for a while, we were originally working on a hybrid model to try to go, and then as case rates rose, we shifted our attention to working on limited in-person instruction. And our plan was to start LIPI relatively soon, and that is still the plan at grades 6 through 12. After we got this new direction from the governor, we've asked our elementary team to put off, initiating LIPI to work on a hybrid model and get ready to go with that. So we're ready to start when we're ready to bring kids back. But the high school and middle school are preparing to start limited in person fairly shortly. So on that note, they're both going to give you a little bit about their plans, and we'll start with Ms. Funderhyde from the middle school.
Thank you, Mr. Bennett, Board of Directors and Superintendent Cordy. So at the middle level, when we started this work quite a while ago, and having conversations and collecting data around bringing students back for limited in-person instruction, we started with identifying just a small group of students who would benefit most from in-person support. They were identified through a process which included analyzing several data points such as attendance, grades, ability to access distance learning, as well as some other stakeholder groups that Mr. Bennett had mentioned. We also gathered input from our counselors and staff members to make sure we're collecting all the information that we would need to make a decision. Our next steps are to call families of the students that we identified, and the goal is to do that this week. And the purpose of those phone calls is to just gather more additional information to determine the supports that would be needed for each of the students who will be participating potentially in the unlimited in-person instruction. We also want to get more information from families about preferred time of day that works for them for the support as well as transportation needs that they might have. So that is part of our criteria within our questions. And our approach moving forward will be continue to, be intentional. And as we prepare to include more students with our LIPI based on need and in each of our phases as we continue to proceed. So we're hopeful and looking forward to being able to provide supports for our students with some needs that just aren't getting it in this model. So with that, I'm going to turn it over. Would you want questions first? Or you want me to turn it over to Ms. Principal Barron?
Let's go ahead and take questions.
Yeah, I just have one quick question. Do you already have an estimate for how many students this would be potentially first round?
Yes, we have and we do in terms of our list and staying within that cohort. But we'll know more after we're able to make some phone calls and have students and families identify whether or not we've got them tiered. And so depending on families' interest of the support in person, we may go down that priority list of students. But our goal is to start within that 20 and the different stakeholder groups that we are calling, if that makes sense.
Other questions? All right, Ms. Barron.
Good evening, everyone. Thank you for the opportunity to come and talk about limited in-person instruction. Like many of us, we are just excited to begin the process of welcoming our students back into the building. And I echo a lot of what Ms. Funderhide talked about in terms of planning and how we identified students for limited in-person instruction. We looked at a variety of data points. And again, I don't need to repeat exactly what Ms. Funderhide said, but we used a lot of those similar pieces. Another thing that was one difference that we looked at was technology, and maybe it wasn't a difference, but just wasn't mentioned, but students that couldn't access comprehensive distance learning because of technology needs. And so in our first round of students, we identified about 200 students total from Sherwood High School that fit that first level and phase of criteria. And so we are in the process of calling students and families to gauge interest and gather information about willingness to be on campus and desire to be on campus and all of those sorts of things. And hope to, as Mr. Bennett said, start relatively soon bringing students in for that limited in-person instruction. We are also now looking at the next phase for this because we are hopeful that we will be able to make sure that everything is safe and everybody is safe, and then we'll be able to bring more students in and more staff in, frankly, because we know that we want to be able to start very small and start with a very small number of staff. We're working with about 4 or 5 staff members who have identified their willingness to come in and work and try this out and kind of help us make sure that everything is safe. And so we're really appreciative of those teachers and their willingness to help us work through this, because this is just a big undertaking. And, we have 1,600 students that at some point we know would love to be on campus, but we want to be really diligent and really careful as we are doing that. And so we are looking down the road at what a ramp up and what a phase in will look like. But like you've heard from everybody across the board, it's a slower process. It's going to take us some time to get there. It's not going to be all of a sudden we now start with 100 students and then a few weeks later we have 700 students here, because we just want to, again, make sure that we're doing it well and that we're keeping everybody safe. And so a lot of the questions that I'm hearing from high school families and high school students is just around more so experiences that our seniors in particular. We talk a lot about how can we help our seniors have a good experience and the things that we love about being in high school. And so know that that is also something that we're working simultaneously on, is how can we provide those experiences. Prom, I heard a lot referenced in the public comments, and graduation and things like that. And we're working on that. We are working to figure out what that's going to look like, but that is a separate conversation than limited in-person instruction. And I think, as Mr. Bennett referenced, the school won't look exactly the same as it has been. And so we're really trying to work with our seniors, with our leadership students, and try to figure out what we can do to meet those needs, because we recognize that those are really important as well.
Questions? Yeah, Eric, go ahead.
So this first phase of limited in person, that's mostly focused on academics, because I know when we first kind of started in this in September, there were some other criteria that we could allow more students in, but that is not part of the limited in person, correct?
I can answer for at the high school level.
Yes.
Phase 1 is around academics. It's around our students that really are our most vulnerable students and needing the support the most. Phase 2, I think what you're referencing, Director Allen, is around, or Director Campbell, I'm sorry, around CTE courses, and that there was a lot of conversation around how limited in person does allow for us to bring students in for CTE courses, and we're looking at that for our next phase of implementation.
Perfect, thank you.
Other questions? Next.
All right, thank you. Thank you, Gary, Marianne, and Melissa. The next topic, the last one, is around the elementary hybrid model. And so we will have Mr. Bennett launch this conversation. We have all 4 of our elementary principals and other administrators in the teaching and learning department also here with us this evening. Mr. Wolmuth, principal at Middleton Elementary, and Ms. Johnson, principal at Ridges Elementary, will be the 2 elementary principals that will be sharing the specific information on behalf of the elementary level. So with that, Mr. Bennett, I'll turn it back over to you.
Okay, thank you, Dr. Cordy. My tee-up is relatively short after that. Thank you. And but the elementary team has been working on this topic for quite some time. You might recall that we were anticipating an opening in a hybrid model in September, in the early days of summer, and then as things changed, we delayed on that. We presented to you in, I think, September, talking about as case rates were falling, our hopes of coming back in a hybrid model. So this is something the team has been working away on, and have gotten back to it fairly quickly, coming back starting this week. So I'll turn it over to the experts who can really talk about, just give you a high-level view of sort of what we've been talking about and what that's looked like. So I'll turn it over, and I believe Mr. Walmuth is going to start. If that's correct. If it's not, Ms. Johnson may jump in.
No, that's correct, Mr. Bennett. I appreciate it. Good evening, Superintendent Cordy and school members. As was stated, we went into the summer expecting and planning for in-person instruction, and so we've been at this on the planning part of it since June, and with a core planning committee that consisted of classified staff, certified staff, and administrators. And then, of course, as metrics changed and events unfolded, our plans have evolved and changed. But the core focus of this was that when we open our schools, our students will receive a comprehensive education in a very, very safe environment. And so throughout the entire process, we've been taking great care to make sure that any return to school for staff and students will be safe. And we've primarily been using the Ready Schools Safe Learners Guidance as a part of our planning. Some of the specific actions that we have taken to ensure this is the first is coming into the year, we planned that our K-5 classes would be such as to meet the 35 square feet per student requirement that Mr. Bennett mentioned earlier. And to that end, as Mr. Bell mentioned, each of our classrooms has been measured and a maximum capacity has been established to maintain that 35 square foot guidance. In addition, we reallocated some certified staff so that we could drop class size numbers at the K3 level, so that we could provide the option for all students to attend school every day. But the reality is that class sizes at grades 4 and 5 are above that threshold in some cases, and it may require a different schedule as we look to in-person learning, but which we have worked on and we have plans in place for that. And I think it's one thing to note for the folks that are watching tonight on YouTube is that we are sending out a return to in-person and transportation needs survey this week to all elementary families, which will really help us to continue with deeper planning for all of the elementary grades. We've planned for and are ready with PPE, masking protocols, sanitizing stations, common area social distancing guidelines, visual screening, et cetera, and anything else that's related to Ready Schools, Safe Learners guidance. And part of this planning has all along has included a week without regularly scheduled classes so that we can have some time to train teachers and support staff, professional development, training, classroom/building preparation, so that we are ready to welcome students when we're able to bring them back into the building.
Good evening, Board of Directors. To continue off where Mr. Wilmoth left, I would like to share with you a little bit about our best thinking regarding our transition to in-person instruction at the elementary level. Much like you heard from the secondary level, our plan from the very beginning of this process has been to create a phased-in approach, starting likely with our K-3 elementary learners per the Ready School Safe Learners guidance, and then adding in our grades 4 and 5 shortly thereafter once they've been able to transition our younger students into the school setting successfully. We're also planning to provide a transition from online learning to in-person instruction with opportunities for students to attend in small groups at first, so that we can help them acclimate, in some cases, even to a brand new school building that they've never actually physically been in before. And then also to ensure that students can learn all of our safety protocols prior to the return of all students at the elementary level. It's also important to note that, just as Director Allen and Mr. Bennett have shared tonight, that school will look different when we return, and it won't be how it was at the time that we shut down in March. And a few specifics here tonight at the elementary level in regards to that. The schedule for our days will be shorter than our school days prior to the pandemic. This will allow for some time at the end of the day for online learning for our students, as well as time for teachers and staff to clean our buildings and our classrooms prior to the start of school the next day. We also know that recess, classroom activities, lunches, arrival, dismissal, etc., will all have a new look. And each of our elementary schools will be a bit different in these items given our physical spaces. But we know that all of these activities, we will need to accommodate social distancing among students and that 35 square footage per student requirement. And so we have invested a great deal of time into making sure that each of these items meets the guidance requirements shared in our Ready Schools Safe Learners document. And finally, we just also want to note that we know in order to keep our schools safe, we will only be allowing students and staff in our building for the remainder of the school year. We know that'll be a big change for our elementary schools especially, but it's also our priority to keep those staff and student groups safe in every way that we can. And so this will be a really important step for us in that process. All 4 of our elementary principals are very excited to bring students back to school as soon as we can safely. And we would welcome at this time any questions from the board about these current elementary plans.
Questions? Jessica?
Yeah, so this may be more than just elementary, but how, I remember when my kids were little that there were times that someone would wake up with a stomach that didn't feel quite so great. And there was a question about, is that I'm a little anxious about going to school today, or is that really real? Or someone had a sniffle and it was at the end of a cold and, you know, suck it up, you're going to school, you'll be fine. And they get there and they're fine. And they don't really transmit things. This world looks a little bit different where you wake up and your stomach's not feeling so good. That's we should be staying at home today, right? And that's a completely different kind of thinking for parents, for teachers, for even for school employees themselves, right? Like if you have a sniffle, we don't want you coming into the building. We need you to stay home today. So have we done any thinking both in how we reorient parents around what staying home looks like and how we work with staff around what staying home looks like? Because the normal, I mean, my mom was a teacher, she absent a real high fever, she was going to school. We don't want people to go to school if they're feeling moderately ill. That's a stay at home day. And how we shift that thinking to keep people safe.
I'll take this question, and other people can weigh in as well, but that's actually required by the guidance. It's in the Ready School Safe Learners to communicate with families about what that looks like. There's options for parents. We have to do screening every day. There's multiple ways to do that. One way is the parent confirmation that my student is okay, that it's not required that they do that, but we can ask parents to do that. And it's required that we communicate with them on this topic. And then we also screen students when they come into the building every day. That's part of the process and part of the procedures we have to follow. And so there are steps in place to do that. And with the part you asked for specifically about communication with parents, that's actually required by Ready School Safe Learners and something we're working on.
And in terms of staff, Jessica, that is in the staff training, and that's communication that we've been trying all along the way to make sure that staff are clear about. And one of the questions that comes up oftentimes is leave. What kind of leave is available, and so then that turns into a leave conversation.
Yeah, and I think that's a very good point. The other thing I'm thinking about, even from a kid parent standpoint, less, I think, mission critical at the elementary stages, but certainly true as we start thinking about what does it look like even in 4 or 5, where missing a test becomes a thing, and how do you make that up, and where's the excuse note, and what's the excused absence versus the non, and that's certainly higher stakes as we get higher up in grades. And so I think those are things that, just as we're sitting here having this conversation, really thinking about what's that look like, that are kind of, yeah, I think will be important to think about in a really proactive, how do we build in more flexibility so people don't just, oh, well, I think I'm fine, but maybe not so much.
And at the very beginning, I talked about how this is not just a what does the school district do or what happens in school buildings. This is a community effort, and I think this is a great illustration of that. Choices that we as parents make about how to respond to our kid having symptoms of some kind, and all the hassles that go with having to stay home because your kid's sick, or arranging for that, or whatever, become just a million times more important in this kind of an environment, and are really part of what we all need to do together to make this work.
Absolutely. That's exactly how I'm thinking about this, is that we have to retrain ourselves as parents and community members in how we think about school.
Other questions? Eric?
So we've used the word cohort a number of times in the discussion here with the elementary students, and I'm afraid I do not have the blueprint memorized. Can you kind of refresh my memory on what a cohort size number of students would be at the elementary level, and how many cohorts are actually allowed to interact with each other, if at all?
So the maximum number of kids, the maximum cohort size is 100 kids. Kids can't interact with more than 100 kids within a given day. That's the maximum number. So that could look at the secondary level, where you're in four classes with 25 kids is 100. So you'd sort of be in 4 cohorts of 25, but it's considered one cohort of 100, if that makes sense. So at elementary, they'd be much smaller than that, which is why it's probably one of the main reasons why it's safer to open at elementary to start with. Is some of our kindergarten and first and second grade classes are 16, 18, 15 kids. And so that would be the kids' cohort that small, and they wouldn't really interact with other cohorts except on the bus. Does that answer your question?
Yes, it does. Thank you. So even though we may have 3 kindergarten or 3, say, 3rd grade classes, those 3rd graders will not all interact in those 3 classes?
No, there won't be interaction between those, or if they do, it'd be to the least extent possible, even trying to minimize time that they're together in the hallways. Lunch won't look the same, recess won't look the same, and it's really to try to avoid mixing those groups of kids, and just keeping those contacts as minimal as possible.
And the reason for that is if you get an exposure, you want to not affect a bunch of kids that have to quarantine potentially or all those kinds of things and keep those groups small. Other questions? Jessica?
We heard a number of times in the comments, and I think it would just be helpful to clarify for anybody watching. And so I'm kind of throwing this out there, but I think this should be hopefully a question you can answer. Why is it not just possible for us to say, anybody who wants to come back, and anybody who wants to stay home, stay home? Why doesn't that actually work, as we have to meet the cohort requirements and plan for transportation, all of that? Can you speak to some of the reasons why that it's not just as simple as let people come back if they want to and stay home if they want to?
It's a good question, and it's really a logistics question. And so we really carefully planned when we allocated students to the cloud campus and to the hybrid, for example. At elementary, we were really able to keep those two separate. It was more complex at the high school and middle school because the course offerings are so numerous. You couldn't have a set of cloud campus teachers and a set of in-person or hybrid instructors. And so at the elementary level, we surveyed families really carefully. We found out how many students wanted to be into a cloud campus model. And then we built a cloud campus model around those number of kids. And it's a real challenge to have some kids sitting at home learning and some kids sitting in classroom for a teacher to manage that. And it really impacts the quality of what can be done. Is it doable? For sure. Is it desirable to not do it? Definitely. And so in a model where the people who want to stay at home, and people who want to come to school, you really lose I think really one of the beauties of the models we built at the elementary level, which is this model where our K-3 kids, if they come back, will have the opportunity to come to school every day in person and get as close to a normal traditional education as we're able to provide with them. And if you start convoluting that where the teacher's got 8 kids at home and 8 in the classroom and they're trying to manage that, especially with the younger learners, that becomes a real challenge. That might be different with older learners where they're more independent, but it's just logistically challenging, and I think it makes it really hard to deliver the same quality of education, especially at the elementary level.
Thank you. That just, I know normally we don't respond to comments, but that became a relative theme. And I know that there's been so much planning and there's so many challenges, especially with younger learners, that I really wanted to be able to clarify that for the record and for the community about why that's just not practically feasible.
And one more challenge related to that is if our class sizes in K-3 move above that threshold of 35 square feet per child, then all of a sudden you lose the ability to come back every day. And that's maybe one of the biggest things, even bigger than the instructional model, is that we were really intentional in planning that out because we felt it was really important to try to bring those students every day. And if you start tweaking and we're razor thin on our margins, there's no room for error to be able to keep those kids coming every day. And so protecting that is probably the biggest thing, honestly, bigger than the other things I mentioned.
Yeah, go ahead.
Yeah. So this is about, I'm sorry that I didn't ask this at the time we were talking about PPE and building safety, but there was conversation about the kind of PPE that's available for bus drivers and the kind of PPE that's available for teachers. Can you talk about other PPE that's available to other members of the education team, including instructional assistants and others that are in the building and working with kids, and that would be there when kids come back to school, and what kind of, we also have PPE available for them?
Yeah, I think I'll actually let Ken address that, as he's been dealing very directly with the PPE purchases and he knows what's in stock.
Yeah, this is Ken. We have been working for the last 9 months to acquire as much PPE as possible, and we currently have the ability to provide all of our staff with any PPE that they desire, including KN95s, face shields, body gowns, all of those kinds of things. And so we've been acquiring a stockpile of those so we're able to provide any staff who desire those to use them. We also, the 2 cloth masks and face shields we're issuing to all employees, not just teachers, but all employees in the district. But we also have the other PPE available for anyone who prefers those.
Thank you, Ken.
Other questions? Sue?
Just for clarification, are we also, as a district, responsible for providing potentially PPE for students? And as an example, if they come on the bus and don't have a mask, will we have that available to take care of them or wherever they are?
Yeah, this is Ken. We have acquired both temporary masks as well as regular masks for student use, not for all students, but we have acquired a couple thousand so that we're able to provide for kids who can't provide their own, as well as students who may have forgotten or damaged those or gotten wet during the day and things like that. So we're well stocked with student sizes, both child sizes and adult for students.
Thank you.
That's just another example of something required by Ready School Safe Learners. There's lots of little details in there, and that's a requirement.
It's a thrilling 90-page read if you ever want to dig into it in depth. Other questions? I think we've run out of topics, right?
That is correct. For
Right.
now.
Right. All right. So what I'd like to do now is basically kind of open the floor to board members, our bargaining unit partners, anybody who's got sort of thoughts, musings, reflections, those sorts of things. And I think I'll go ahead and jump off and just kind of give a little bit of a sense of what I'm thinking. I really want to get kids back in school. I've wanted to have kids back in school since the very beginning. In my day job, the health authorities started out the pandemic trying to keep kids in school despite the fact there were cases. And the first cases were in or associated with schools. And I think that decision lasted less than 24 hours when various school boards and parents and staff kind of voted with their feet and we went that direction. We were so close to getting school open then in the fall before we started the fall surge. And that was really disappointing that we weren't able to get to that point. But I'm also not willing to get kids physically back in school no matter what, right? There was a comment that got made that said something to the effect of it's not a question of if, it's a matter of when and how, and I really think that's exactly right. We've heard a lot about how tonight, and I'm really encouraged by we've had a couple of false start opportunities to do this planning and be ready for bringing kids back into our buildings, and so I'm really encouraged by the thoroughness of the how, the level of protection that's provided by the Ready Schools, Safe Learners guidance, those kinds of things. I also think we haven't talked about this, but I think the how is not bring 1,600 or 5,000 kids back to all of our buildings full time all the time. That it's more careful than that. Although we've heard lots of passionate testimony about different age groups and grades and those kinds of things. I think it's go slow to go fast. Bring groups back. See how it goes. Expand and build up toward that. Ultimately, if our conditions allow, I'd like to be able to see us have kids at all grades back in some fashion. But it's also true that we're in the middle of a surge right now. We're in the middle of we now for sure see cases stemming from Christmas. And it's likely that we're going to see cases stemming from New Year's on top of that. We got through Thanksgiving with that surge being relatively small and really short, peaked quickly and came back down. And I can only hope that that's the same kind of trajectory that we're on, knock on wood, that we're on this time. But, I want to see the guidance around metrics that comes out the 19th. And I want to see where we are in terms of cases. Are we going down or are we going up before I'm personally willing to answer the when question. But I'm really interested in working together in partnership to figure out more details of what how looks like, what the roadmap looks like going forward, so that we can be ready when the circumstances really are right to get kids back in. And my gut tells me that that's sooner rather than later. That's kind of where where my head is right now. Jessica.
Yeah, Pat, I'm very similar. I think, so I want to be really clear. I want to get students back, but I want to do that in accordance with science-based health metrics, with the guidance that and all the learning that's come and the Harvard model, really looking at what do those tell us? How can we do that safely? Because this is a community effort. And it's not just about impacting kids or families or staff or teachers. It's about impacting all of us together. Education is something that we do in the commons, and that means that we have to work together. We have to trust each other. We have to reach out our hand in partnership, not in blame. I want to say very clearly that this board member has been grateful for the ongoing partnership with our bargaining units. It has been a long relationship, and we have been through mighty challenges together during my time on this board, through recessions, through real tough challenges. And I think I want our association leaders to hear we are grateful for the tremendous changes that they have made in their professional practice to make distance learning work, kind of shifting on a dime and adjusting. And we know that this is a challenge. We want to work together to find a way that we can all reopen schools together. And I think I want this community to know that our teachers and our staff are heroes. They have done heroic work. They have been our partners every step of the way. And I look forward to working with them in the hopes that we can address concerns that folks have, provide information, and plan together. And that's my sincere hope. And I think really, really important for the community to know and understand how collaborative this relationship is and how that has benefited every single one of our students in this district during the time I've been on this board. And last but not least, I think for the kids and families and teachers and staff, and for the teachers and staff that are also members of this community, and so our parents and families too, this year has been challenging. And I see it in my own house with my own kid that's doing online learning. It's different and it's hard. And they are learning skills that will help them, but there are also significant downsides. And I think the ups and downs, we heard all of that through the public comment this evening and through the letters that we've received. To all of them, like we feel that journey with you. We hear those stories. Our hearts grieve with families who have lost or suffered because of COVID. We grieve with the families whose kids are struggling with mental health issues, which, by the way, we were struggling with that well before this pandemic, and we have got a lot more work to do on that front. And this district has made some real serious commitments, and we're not done yet. But there's a lot to come, and we want to know that we're standing in solidarity with you. These challenges, we feel them with you as members of this community. And I think the most important thing that we can do is wear masks, social distance, hand wash, and hug your kids. Let them know that it's resilient and it's okay, that it's hard and it's going to get better soon. But we all got to do those things together so that we can get back. So that's a lot, but that's what's on my heart.
But don't hug your nieces and nephews at a big family gathering. Right?
Just your kids that you live with.
All right, so again, the floor is open for anybody, staff, bargaining unit reps, board members who want to basically reflect it all or kind of share where they're at or what's on their mind.
Just kind of reiterating a little bit, but I think really the success of these efforts to do Libby or restart the hybrid is really going to depend on the continued partnership with the community. When this happens, it's not a signal that things are all better and you can stop wearing the mask, you can start partying with the neighbors again and doing those things. In fact, it will be more important than ever to continue these efforts and to limit the spread. So we need to keep up what we've been doing, and that partnership is what's going to make or break this effort. And Sherwood has done it before for us in the school districts in the past, and I know they'll do it again, but we got to keep committed to it.
Thanks, Mike. Who? Yeah, anybody on the Hollywood Squares up on the wall?
Hi, this is Nancy with the Licensed Association. I have just a few words, if you don't mind. I appreciate the conversation, and I know that our teachers, like every other teacher in the state and in the country, we want to get back to our classrooms face to face as soon as we can do this in a safe way that doesn't risk our health or the health of our family members. And I know we can get there. Our hope is that we'll be able to continue working closely with our district administrators to address their concerns of colleagues, many of whom are Sherwood residents and parents of school-aged children. A recent SEA survey identified several areas of concerns when thinking about bringing our students back to in-person, and we have shared some of those, and we will continue to work with you, with all of you, to make sure that can happen. We need to ensure that protections are in place so that when students return to buildings, we don't experience an outbreak, which would force us to go back to CDL, which would cause even further disruption for our students and our families. As has been stated several times tonight, our families need to understand that once our students return in this hybrid instruction, until we can get this virus under control, it's not going to be business as usual. And it won't look the same. I mean, our children aren't going to be able to hold hands if they're the line leader with the teacher as they walk down to specials, and they won't be able to move freely through the buildings or cozy up on the carpet for read alouds. But if we all are vigilant, and if the whole community follows the OHA and the CDC guidelines, and we do those things, we limit the sleepovers and the birthday parties that are unmasked and indoors, and the large indoor gatherings, we know we can get there. I mean, we all want to see our students back face to face. We do just as much as everyone else, maybe even more so. And so I'm hopeful that we can all continue to work together so that we can get all of our kids and our staff back in the buildings, and eventually we'll get back to school as we know it and as we love it and have come to expect. Thank you, Chair Allen, Board Directors, Dr. Cordy, and all the district administrators for listening to and responding to the concerns of our licensed staff as you make plans to bring students back. We have always appreciated the partnership and the collaborative relationship that we have. And I have all the faith in the world that that is going to continue. So thank you.
Thanks, Nancy. Other thoughts? Eric?
I guess as we listen to as I listen to all the comments tonight, I think one of the common threads in there is that everybody wants to bring kids back, and we have been working on this for many months, and we have been dangerously close, even back in September, to meeting the metrics within our community. And I think a lot of the discussions we have had been around this is a community effort. It isn't just something that happens in the school. As Jessica kind of brought up earlier, it gets up with how are your kids feeling in the morning. You look at the numbers within our community, and we have proven that we can do this when we follow the guidelines. And I'm hopeful that we can kind of start heading back to that point. With that said, I think one of the things we talked about in September when we were talking about opening is there was a fear that we would be oscillating back and forth between opening, closing, and I just really do not want to be in that point. And so when we get to a point where we can do some limited in-person instruction, and we all kind of are in this together, I think as a community we can kind of get this down so we can keep moving in the right direction. And I'd like to thank everybody who actually submitted public comment. Hearing all the stories and everything, you realize that this is a lot more than just, hospitalization numbers and infection numbers. We have, it really affects people in various different ways. And I guess a lot of it too, I just kind of want to thank the district staff for the incredible amount of work that has been done, not only getting ready for distant learning, but preparing for the point where we might be able to come back and have our kids back in the school. And this is not something that just kind of popped up on December 23rd when the governor made the announcement that 197 school districts can make their own decision. This is something we have been working on for a while, and it is a community effort. So thanks.
Thanks, Eric. Sue?
Okay, so this is going to be a little bit all over the board, so I apologize. I just have a lot of random thoughts, and I know a lot of it's going to be probably repetitive, but I really am honestly thankful for so many emails and the public comment. I can't think of a single one, and there were a whole bunch that weren't professional and thoughtfully prepared in nature and respectful at each turn. It hasn't been the case in the last 13 and a half years on the board, but it really.
I'll show you some I've got at work.
Yeah, I don't want yours. But it was really impressive and thoughtfully done, and it took folks a lot of time, and some of the sharing was very personal. So I really do appreciate that. I do want to point out that it has been frustrating, I think, for all of us in this room, certainly, and everyone else that's been dealing with this since March 13th or prior to that. We really haven't been able to make any decisions. We've been so close. Although I gotta say, be careful what you wish for, because here we are, and these decisions aren't going to be easy. But it does feel good to be able to have this conversation in Sherwood, to be having these discussions and relying on the relationships and not someone just telling us what Sherwood needs to do. I just really appreciate that transparency, and that we've all put students first for so long. I mean, we know it's all about the kids. you know, the entire education community matters, of course. But you can't get it back. You can't get senior year back or kindergarten. And I think that's the hard part. And I think that's why, you know, it's going to be so great to move forward, even if it's baby steps, to get some semblance of in person and that touch that we know is so critical for all of these kids, to happen as soon as humanly and safely possible in this district. I just feel absolutely committed, and so really appreciate the you know, this discussion and our yearn to move forward and to get kids back in person as soon as appropriate. So thank you.
Other thoughts? Looking back up at the big board to see if anybody up there wants to comment. Anybody else?
I do think it's useful, again, not knowing how many folks we still have watching YouTube. And if you've been watching YouTube with us this whole time, I feel like, you know, God bless you. Good job. Like, way to do public engagement well. I think it is helpful to note for everyone that the reason, like, we need that professional development time, we as like our teachers and our administration, all of the teams have done such a great job of really focusing on how do we do CDL well. We need to give them a brief moment to do that transition well. And I really think it's important for us to help. I think we've all had those conversations in prior meetings, but given the kind of focus on this moment, I think it's important to remind the community we need to give folks a moment to breathe so that they're able to make that transition, so that when kids come back in, they're able to do so safely, and that they're prepared to teach kids how to be safe too.
Yeah, thank you. All right, last chance before I turn it over to Dr. Cordy to close this out. All right.
Okay, thank you. A couple of brief comments in closing. First of all, I want to just really note and tag on to what Ms. Stoffer talked about us working together, and so many others have talked about this as well. And this evening, you all had the opportunity to hear about the work that has been taking place over the course of the last 9+ months, while our teachers and staff have just worked so hard on delivering within the CDL model. And this evening was our opportunity, and you heard it from the elementary team, about the work that has taken place, that took place early on and continued to prepare for a hybrid in-person model. And so you heard some real specifics this evening because we wanted to make sure to share that this hasn't been something that we just started thinking about since December 23rd. And that was, you know, really the purpose about sharing some of those really specific examples about what a hybrid in-person model at the elementary level, most notably, could look like. But I cannot stress enough that we have so many more conversations to have, listening to our teachers and our staff members about their concerns and about working with them on creating this path forward. And so, though you heard certainty around some of the elements that can happen, please know, and I want to make sure that the folks who are still with us on YouTube are hearing us say that. And so that's super important for me to stress before we conclude this evening. And last, and Chair Allen, this might make you a little uncomfortable, and for that I do apologize. But earlier this evening, you made reference to your day job with the Oregon Health Authority, and you all of us who know you and have the pleasure and the opportunity to be able to work and lead alongside you, know that you separate out the many different hats that you wear so professionally and so thoughtfully all the time. But what we know, what my team and I know, and I think it's just really important to share this here, is that we benefit so much from your heart, your passion, most certainly your knowledge as it relates to all the things within this pandemic. And I cannot imagine what your days look like within your career at the Oregon Health Authority. I have a little glimmer because you and I work so closely together. And I just want you to know that we know that you are a true public servant. And we are thankful for you. We're thankful for you as a leader in this community, as a leader in this district, and our community and our state. Those who have the opportunity to know who you are and how your heart is wired and your intentions, know that you are in the role you're in truly to serve. And so I just want to thank you for that.
Really glad I have a mask. All right, can you give us a little bit of a preview of what we should expect for the meeting on the 13th?
Yes, we will continue in conversations with our association partners, and we'll come back with a next iteration, the next step down this path on the 13th at our in the information and discussion portion of our board meeting next week.
If there's nothing else, we'll go ahead and adjourn our work session. Thanks everybody for being here. Thanks for everyone who participated online, and thanks for watching on YouTube. We're adjourned.